Today's workshop will be dedicated for our new products V-Line that we just launched in May. Product for tissue stimulation and skin rejuvenation. Our workshop will be hosted today by Professor Noura Lebbar, medical doctor, aesthetic surgery professor in University of Genoa. So please make an applause for Professor Noura. Welcome on the stage. So I'm wishing you a very nice time with us, and you will get as much science as possible driven by Professor Noura. Thank you so much.
About business, about connecting, it's also about humanity. So when you work with such a wonderful person with a big heart, you just want to be in touch with that person. Whatever any business you do, any product you're using, it's very important, the human part of our job, right? So very welcome to this beautiful city of fashion, of beauty, of excellence, of also, charm, right? مرحبا مرحبا بكم هنا معانا في ميلانو في إيطاليا في Infini. Vous êtes les bienvenus pour les personnes qui viennent de France et du Maroc, ici à Milan. J'espère que vous allez adorer cette journée, ça va être excellent. Estoy muy contenta de recibir a las personas que vienen de los países que hablan español. Bienvenidos. I have all the language. So, bienvenidos. Thank you for your time. Thank you. I will try my best, speaking all my techniques, what I know, and to share with you whatever I learned in 15 years. Now I'm working as a cosmetic surgeon and a technologist since 15 years, so I have little experience and quite independent. So, I think you know about Infini. Infini was born actually in Italy in 2020. We are not a old company, but we are already in more than 80 countries. And almost, all of them. So thousands of treatments already have been performed all over the world. Here we have almost 8 countries. We are already present in more than 80 countries. So you can imagine how many products have been already used. And fortunately, hopefully, but it's not fortune, it's not hope, it's science, no adverse event was reported. This is very, very, very important. So we are present in all these countries already. We have trust from our, the distributor of the company, but also for doctors who are using, because the patient, they see the result. They see the lasting result, which is amazing. So it was born in Italy. What we know about Italy? Do you agree that it's one of the most beautiful countries in the world? Why? Because of the fashion. So myself, I have been doing some fashion for charity, to help a stylist friend of mine, for art, for also interior design, cars, and natural beauty, the beauty in the nature. Like this is a photo of Amalfi Coast. I think you know it in south of Italy. So we need to respect that beauty, the creativity, the quality, and the exclusivity. Because it was born here in Italy. It needs to respect all that standard. So our philosophy in this brand is the precision I know that sometimes we say that Italy, they're not very precise, so on, but when we do it really very well. Innovation, science, and we are famous also for natural beauty. If you go around in the street, we will not find so unnatural people, right? We like beauty, but preserving the natural beauty without overdoing, which is very important. And our philosophy also is to preserve the natural beauty by focusing on skin health. Because it's easy to remove wrinkles by feeling, just feeling. But what about preserving the natural beauty by simply preserving the health of the skin, avoiding the aging of the skin, rather than waiting the wrinkles and then just feeling like a balloon? And of course, you will not have wrinkles, but it will be a healthy skin? No, for sure, no. So these are all the standard of the beauty all over the world. The most important is to conserve, to respect the initial beauty, the initial genetic of the patient. Our strengths are especially in the quality of the hyaluronic acid powder, which is the pharmaceutical grade of hyaluronic acid, because there are two types of primary hyaluronic acid. You can use any one, and that will not give you the best quality of the hyaluronic acid of product you're using, the lasting result, the inflammation that you can have, and so on. So it's very important to use the best quality of hyaluronic acid, the primary hyaluronic acid that you use. And our hyaluronic acid is a pharmaceutical grade, which needs to follow up many standards before going on the market. And the latest research that we did in natural hyaluronic acid cross-linking technology is to have the less possible of the BDDA, which is the cross-linked agent. So less BDDA you have, and of course, less adverse event you can have, and less inflammation at short and long term. So the latest technology allows us to have the best quality of fillers that in that way they can integrate perfectly into the soft tissues, preventing aging without overfilling. We talk about overfitting. Do you imagine these famous people like Madonna, like Nicole Kidman, who have these pillow faces and overfilled syndrome? So what I was telling you, if you don't prevent the aging by focusing on the quality of the skin, preventing the ROS, the radical oxygen spices, the inflammation, the aging, you will end up feeling and having this not natural result at all. So we have all the certification, the CA certification, the ISO certification, which allows us to be injected, because there are a lot of skin boosters on the market, but they don't have the CA to be injected. So this is very important. Our aim is the safety. Be safe, please. Use the right product. We don't want, in aesthetic medicine field, we can't mistake. So the patient, they come for us not to save their life, but to make them more beautiful. We can't not achieve that goal. We can't give them any side effect. It's absolutely right. So these important. You know our brand, our product before. So we had the non-lidocaine filler that you know perfectly, all the range of the filler, and our also strength that we try to make absolutely all the product necessary for each use. So we will not say, no, we will have just 3 type of product. We want to have all the possible product that the doctor can combine and have the best combination and the best adaptation to his patient. So here are all the products we had before about our fillers, which were the first launch in the market without lidocaine. Then we add now the lidocaine, having the soft, then the S plus, M plus, L plus, and the XL plus, which has the lidocaine, which is a very comfortable, honestly. I don't know if you like to use lidocaine in the fillers. I believe that it helps. It helps a lot. So it make the experience the patient they have more comfortable. The results have been really amazing with long-lasting results. For example, for the XL, we have results even until 1 year. We have also all the range of Infini Premium Meso. You can see well the screen, right? I'm hiding it being here. Is that fine for you? Okay, that's perfect. And please, if you want me to translate after in any language, French, Spanish, Arabic, just let me know. For people who are not very comfortable with the language, no problem, I can translate anything. So we have the Meso Plus also, which the A plus, H plus, Collagen Plus, which already have given amazing result. And also we have all the range with the DNA super boosters. And remember, with the Collagen Plus, remember that amazing result that can give on the scars and on the neck, on all type of skin aging, neck, face, and also any type of scar. Okay, let's come back to our hyaluronic acid. So the hyaluronic acid actually is called hyaluron, which is an anionic non-sulfated glycosaminoglycan, which is distributed widely through connective, epithelial, and neural tissues. And it comes from the fermentation actually of Streptococcus zooepidermicus. So hyaluronic acid actually has been injected in France for the first time in a famous tennis player, which is Amélie Mauresmo in 2002, just to go on the story of hyaluronic acid, because hyaluronic acid made the story of aesthetic medicine, right? But let's go a little bit deeper. What is it? What is the aim? And so on. But then until 2003, the US Food, Drug and Administration, FDA, approved hyaluronic acid as a wrinkle treatment. That's why we are using it in our technology. It gives so many amazing results on anti-aging, to prevent the aging, to stimulate the extracellular matrix. We will see all this technical in details. So our exclusive technology, I told before, high purity of HA, which is a pharmaceutical grade of HA, so which give me safety, high performance, and an excellent tolerance for the patient with no side effect. We have also the selective spectrum technology, combining different molecular weight which are most switchable for biorevitalization. Sometimes when you read the box of a biorevitalizer, you see like 30 ingredients. But they have studied this. What are the interaction between all these ingredients, right? If you read it, maybe you see 20, 30 ingredients. How can you be sure which interaction can be in vivo of all our ingredients, this ingredient on our skin? And also we have this it's a patented fragmented hyaluronic acid technology, which come from 28 until 40 monomers. This is very important because it will penetrate on the deeper layer of the skin. Smaller is the molecule, and deeper it's gonna go, and slowly it's gonna be degraded by our enzymes, which degrade naturally our hyaluronic acid. So, what is the aging process? What we have when we age? What happens in our skin when we age? So first, we have reduction of the proliferation of extracellular matrix cells, reduction of fibroblast production of collagen and elastin, more free radicals. So we have, which will degrade the collagen and elastin, and we have collagen structural also alteration. So how we age. The fibroblasts are our main proteins, our main cells in the extracellular matrix, which will give healing
Angiogenesis, like stimulate the microcirculation, produce cytokines and growth factors, will produce all the extracellular matrix components, which are elastin, collagen, and hyaluronic acid. And also all the glucosaminoglican, which hyaluronic acid is part of them, because we have our endogenous hyaluronic acid, which we produce ourselves by the extracellular matrix, by the fibroblasts, and we have the supplement, like the out when we inject our hyaluronic acid. So here we have a young skin, how you can see how the repartition of the collagen, less elastin, and it's really a reduction of production by the fibroblasts of collagen and elastin, and also hyaluronic acid. So we have the elasticity that we will lose, and we will lose also the thickness of the skin. I will talk to you about the collagen composition. So why we are providing exactly this element for our in our skin boosters? Because the collagen composition is mainly from amino acid. So look, we have 33% of glycine, 13% of proline, and 9% of 4-hydroxyproline and 3-hydroxyproline. And then the elastin composition doesn't have hydroxyproline, has glycine, alanine, proline, and valine. These are the chemical composition of our amino acid. That's why we provide the amino acid in our skin boosters. What will do the hyaluronic acid also that we provide, so it will give the moisturizing, it will moisturize the connective tissue. It will help and support collagen and elastic fibers, and it's a type of extracellular matrix scavenger. It will remove all the radical oxygen spices, like all the garbage that we need to remove from our extracellular. And also, we have this amazing component, which is vitamin C. Vitamin C will also inhibit the melanin synthesis by the inhibition of the tyrosinase enzyme. So that's why the vitamin C not only is an antioxidant, but it's of course a brightener, as you saw, because it will inhibit the tyrosinase, but it's also a very strong antioxidant. Look, this is what we have on the collagen production when we provide hyaluronic acid on the skin, of course, injecting it in the dermis on every superficially or a little bit deeply. We have plus 92% of collagen synthesis. Here you can see the proliferation and collagen migration with confocal microscopy. It's like when you do a biopsy, you have the same result with confocal microscopy. You can see exactly the skin number of collagen and so on. So what we said about the amino acids. Amino acids are fundamental for the synthesis of any protein. Without amino acid, we can't synthesize collagen, we can't synthesize elastin. Do you agree with me? Especially the essential amino acid that the body cannot produce. So once you don't have them on the skin, you can inject any skin booster you want. You will not stimulate the production of new collagen and new elastin. So the amino acid, it's food for the fibroblast. You don't give them food, they will not produce our collagen, elastin so preciously, and our endogenous hyaluronic acid. What about the choline? The choline is amazing also. It will give an immediate lifting effect because it will allow the contraction of the epidermal keratinocytes, and has a long-lasting effect because it works on muscle fiber, will regenerate the extracellular matrix, and also have an antioxidant effect. So, why we were thinking about the V-line, why we called it the V-line? Because unfortunately, aging, first of all, we have when we are young, so the basis of our triangle is upper. around the eyes almost. But then this triangle with age, unfortunately, invert. So we have inversion of that composition. So we have the base of the triangle is down. So we want to become younger also. If you see the most beautiful woman, almost they have this V shape. We will see how we can do the V shape. Sometimes we need to combine also with some fillers. I agree with you. We need some fillers to reshape, to give more projection of the chin, the mandibular area. In fact, I will show you also some pictures because you need to combine. You can't only do some skin boosters, of course. So that's how we're gonna achieve the V shape with fillers. Then we're gonna maintain the results, the lifting, with all our skin booster, especially with the V10, with the polylactic acid, which give lifting, volumizing at the same time, and biorevitalization. So here, all our line, the V line, V shape, VA for the eyes, the V1, the V2, V5, which our amazing new skin booster with the 3LS, the V10 with the polylactic acid, V20, and we have also the V body. I will show you then that you can combine with the V10 when you use it for the body. Let's see the composition of the VA. We have 5 ml. In 5 ml, you have the fragmented hyaluronic acid, which is between 20 and 38 monomers. Okay, remember the importance of this fragmented hyaluronic acid because they will stimulate the receptor CD44 directly for the fibroblast. So we will have a direct stimulation of the proliferation, growth, and migration of the fibroblast. The amino acid complex it contains is complete. It has everything. So isoleucine, leucine, lysine, proline, valine, glycine, serine, alanine, and cysteine also. So, which will give my cysteine, it gives also some brightening effect. So we have the complete composition, amino acid, fragmented hyaluronic acid to achieve the best results. The protocol, usually I perform 3 sessions every 3 weeks, then I repeat after 6 months. So please note that the technique for injection, I like to inject with needle 30-32G. 4 millimeters is better to use a length like a shorter length, but you have a good hand. You can use even the 13 millimeters, but you will go very superficially. You need to go in the dermis. I will show you the technique. You can use also a cannula, 25G. You can use both. Usually I combine cannula because I want to be a little bit deeper, and I need the cannula to stretch the tear trough ligament. I will show you how and why. And then I inject also with needles. Some patients, they don't want to have any signs. They need to come back to work immediately after, so I will use only the cannula. But please, for the cannula, never smaller than 25G. Otherwise, it will act like a needle. You're going to have the bruising. So the maximum I can is 25. Even the 25, I like the 22. 23, 22. I'm sure I will not have any bruising. I can't act like a needle, and I'm very safe. So you know the tear trough anatomy. Actually, it's all because of the tear trough ligament that we have the tear trough deformity. So sometimes we have a skin excess, not only tear trough deformity, you know. So when you have the skin excess, you need to combine with some technique, with some energy-based device, like with some radiofrequency, fractional radiofrequency, and a skin booster both. So in this example, in this patient, I combine biostimulation, okay, skin booster, my VA, with the energy-based device, of course not the same session. In this case, I used a plasma energy device, but it's up to you. There are a lot of other devices in the market when you have really skin excess, and you can obtain this amazing result combining both of them. So let's see, please just, if I ask you, as my patient, have the privacy, if you take some video, you can take it, but don't post it on Instagram, that's fine, because it's our doctors and so on, my patients. So I do my drawing, as you see. I try like to take a line from the tear trough ligament, and here is my entry point. Then I will inject my product, my VA. You can inject also some filler. Usually I use the S+, okay, and combine it also with the VA. If you really have an important depression and an important tear trough deformity. I'm using a cannula 23G, and if you're using a filler, please be under the orbicularis muscle. Be deep. Whatever the filler is, if it's soft, not soft, we don't want to have any Tyndall effect or so on. It's not very nice. But when you use the VA, you can do well in sandwich technique, under the muscle and then superficially with the cannula. Okay? No worries. With the VA, you don't have any problem. You remember, for example, this patient, she came to me, she's only 25 years old. You can't inject her with a lot of filler. She wants to improve her tear trough deformity. So what you need to do, if you inject a very small quantity, in her case, I inject 0.3 in total. Okay? So how you can do, you can stretch the tear trough ligament with your cannula, because the tear trough ligament will give this tear trough deformity. So if you stretch it with this movement in fan movement, without injecting product, just stretch it, it allows you to inject a very small quantity of product. And so you can use it also for very young patients. So, and she was very happy, and it lasts a long time. You know about the tear trough, when you inject filler, it's very important to inject the minimum quantity, because the inflammation and all the side effects can come from that. So because it lasts a lot, this patient, for example, what you see on your right, it lasts for 4 years, the fillers. So you need to inject it in the right layer. You need to inject it deep. And if you want to combine it with the VA, you can combine it in the same session or inject it before. Some patients need fillers. Other patients, they need only the VA. It depends on how important is the depression. This patient, of course, she needs fillers. She needs also some energy-based device because she has an important skin excess. This patient also, you can treat her only with the VA. Okay, so what about the potential complication of tear trough procedure with fillers? That's why we love VA, we love a skin booster, which will give me volume, which will never give me any side effect that we can use, for example, for a young patient. What? It's the skin discoloration, the Tyndall effect when it's injected. This is due to the technique of implantation, which is too superficial. You can have a long-term edema. Some patients, they come after 1 year, them telling you the edema go and come back, because it's a very, very delicate area. It's full of lymphatic drainage there. So you really need to be careful and inject the minimum quantity. Risk of infection is not reliable if you have the good practice. You disinfect, everything is good. And you can have also the formation of some granuloma if you didn't use the right filler. And of course, the main side effect is when the patient is not happy. She's telling you, I'm not having results, or I'm having too much, please dissolve it. That's why we want to focus. This, for example, it has been injected too superficially. This is my own patient. See here, you can see still the filler after 1 year. It has been injected too superficially. So be careful. It needs to be injected deeply under the orbicularis muscle. Also, this patient, it has been injected superficially in my point of view, and it lasts years. So that's why if you don't have a good hand, you don't have a real experience, don't use fillers on this area. Now, let's talk about the V1. The V1 has still this technology which is almost present in all our V line, the fragmented hyaluronic acid. which from 20 to 40 monomers. We have the amino acid complex, vitamin complex. Remember, we talked about the choline. The choline is important for the formation of the acetylcholine. Okay, acetylcholine is necessary as a neurotransmitter for the contraction of the muscle, right? So it will contract our dermal muscles. It will give tone. It will, usually we use the Botox. It seems like strange because we use the Botox to block the muscles. No, we want to, we need the muscles also for our dermis. They are important. So that's why we are using the choline, which give immediate lifting effect, especially on the area around the eyes. Of course, the contraindication, don't use it with patients who already have some botulinum toxin on their face. Then we have the serine, alanine, cysteine, lysine, proline, and glycine. So all our amino acid complex. The choline is a precursor of the acetylcholine, as I told you before, so it will maintain the muscle and skin tone. It has immediate lifting effect. The protocol, 3 sessions every 2 weeks, to repeat after 6 months. Of course, if the patient, she come after 3 weeks, that's no matter, no problem. I mean, there is not strict, it's not like a medicine that we are taking every day. No worries. The result, restoring the skin tone and elasticity, preserving the muscle tone, and the lifting effect. The injection technique with needle, cannula, or both. It's up to you, but I think as it's very liquid, you can inject it with needle. If you want to avoid bruising, you can ask the patient to have some arnica, which is no natural anti-inflammatory, even the day before or the same day, and the 3 following day, to stop any anti-inflammatory, non-steroidal anti-inflammatory, some aspirin and so on, before the treatment, and apply some ice. For me, the ice is a miracle. When I apply it, it gives you vasoconstriction, and you don't have any bruising. Of course, you can't inject adrenaline everywhere to avoid injection. And I give you a small tip also. You know the tranexamic acid, which has a lightening effect. You can use it as if you have some bruising to stop the bruising. It's a vasoconstrictor. So let's talk about the V2 now. The V2 has hyaluronic acid fragmentated. All of them, they have the same hyaluronic acid fragmentated. We have the amino acid complex. We have the glutathione. Remember, glutathione, vitamin C, they're both antioxidant and they have a brightening effect. This is very important if you have you need a brightening effect. In effect, you can use it if you have dark circle also around the eyes with amazing results. As it contains vitamin C, it will burn a little bit because the vitamin C is a little bit painful when you inject it. It burns because it's acid. You can inject it also for every pigmented area, okay? Inject in a pigmented area and then use microneedling immediately after, and you will have a brightening, an amazing brightening effect. And we have also the cysteine, which is not only an amino acid, but it has also as an effect as an antioxidant. 3 sessions every 2 weeks, repeat after 6 months. Very easy. We don't have very difficult and incredible protocols. Needle, cannula, both. Usually I like both. So the result, potent antioxidant, cell detoxification, regeneration, especially for the glutathione and the vitamin C. Firming effect. Sometimes we inject also in IV the glutathione because we have IV intramuscular, especially because it has antioxidant. You know, we have this IV drips, cocktail, vitamin IV drips. You heard about it, and you use the glutathione for that. And I think in Asia, they use it for brightening. Yeah, and then now they stop. In IV, they were using it. Now they stop it because it has some liver issue. So it's very bad. But injectable, it's amazing. Doesn't have any side effect. Okay, and remember again, with this fragmented HA with between 20 and 40 monomers chain, repetition, they will stimulate directly the receptor CD44 for the fibroblast. Let's talk about the V5. The V5, the contour, we talk about contour stimulator. The contour stimulator what is it? So we have this patented, we have the only one which combine the hyaluronic acid with 3-allose. The 3-allose, it's actually a sugar. It's a type of sugar which has never been used, but we found it naturally in many organisms. But it's a natural product. It's a natural substance. How it works? It will give me a cellular protection against stress. It will form a glass-like matrix that preserves my hyaluronic acid. You know that why my skin degraded the hyaluronic acid easily and very quickly, very fast? Because of our enzymes, which will degrade it, our natural enzymes. So what we do, we will give the hyaluronic acid with 3-allose. The 3-allose will protect my hyaluronic acid, will form a type of film, and will make it last longer, will have longer effective results. And also, it stabilizes our proteins. Because it's protecting the cell, it will protect the membrane of the cell, which more under the oxidative stress and the aging effect. So we have osmotic regulation, chemical stability, and a thermostability for my hyaluronic acid. So it's very important to add it to my fragmented hyaluronic acid because it has an osmotic regulation. So it's a way for me to have long-lasting results resistant to my natural enzyme degradation, which will degrade my hyaluronic acid. So it will give me a long-lasting lifting effect using a small quantity of product. It's like I have used, instead of using 2 ml, I have used 4 ml of hyaluronic acid when I use the 3-allose with it. So this is how it works with the V5. So 2 ml of syringe of V5 contain 50 milligrams of hyaluronic acid. It's a lot, it's really a lot. And then 20 milligrams of 3-allose, which is this sugar, this new molecule which has been used in our V5. And we have 2 molecular weights. Hyaluronic acid have 2 molecular weights. One is between 200 and 400 kilodalton, and one is between 1,200 and 1,500 kilodalton. Why it's important to have 2 molecular weights of hyaluronic acid? Shorter, smaller is the molecular weight, and deeper it's going to go on the dermis. Bigger is, superficially it will come. So we will treat and stimulate all our layers, all my dermal layers, which is important to stimulate them. So if you see here, here are the different molecular weight and where they act and what are their aim. The 2,000, of course, we're not so precise. If it's a little bit less than 2,000, it has the same effect. It will have as effect remodeling the extracellular matrix thanks to the synthesis of structural elements of the dermis, which are the collagen, elastin, the endogenous hyaluronic acid. Then it's an immunomodulatory and also will adjust the angiogenesis. The medium weight, molecular weight, which is around 1,000 kilodalton, will protect the fibroblasts and the structural element of the dermis acting as a free radical scavenger. So it will detoxify my extracellular matrix. Do you know that all the diseases that we have are due to a dirty extracellular matrix? Because it's not detoxified. That's why we have like dysregulation of our immunity and a lot of illnesses and diseases which come. So it's a very important role it has. And it has also an anti-inflammatory effect. Aging comes from the inflammation. The low molecular weight hyaluronic acid, which 500 kilodalton, has high capacity to retain water, and it has an anti-inflammatory effect. So all our technology, selective spectrum technology that we talk about it to give the best combination of our hyaluronic acid molecules with the complex vitamin complex giving the best, to achieve the best result. We have a multi-sterilization and pharmaceutical grade of my hyaluronic acid that we talk about it. That's why we talk about the purest hyaluronic acid that we can have. So it's just like to explain our technology, which is selective spectrum technology, which will combine the best ingredient to achieve the best result. Okay, so we have the best hydration and long-lasting result for the skin. The treated area can be face, the periocular area, the cheeks, perioral area, and also the body as the neck, décolleté, back of hands. So, how to lift with the non-cross-linked HA with the V5? So, we have a very high molecular weight. We have in total 70 milligrams of hyaluronic acid. So it will give me a lifting effect, especially because of the effect of the 3LS, which will make my lifting results, my concentration, my high concentration lasting more because of the protection against the enzymes, the degradation enzymes. And also the V lifting point are based on the retaining ligament actually. So the point 1 will be on the zygomatic cutaneous ligament. The point 2 will be on always on the zygomatic cutaneous ligament. The 3, the upper masseter cutaneous ligament. The 4th on the mandibular cutaneous ligament. And the 5th on the platysma auricular fascia. So let's talk about this. Normally, a skin booster should be injected in the dermis, right? But we believe that injecting it in the muscle, you know that we inject also in articulation, in orthopedic field, the hyaluronic acid, because it gives a healing effect. So if you inject it a little bit deeply in the subcutaneous, it will give very good results also on stimulating the retaining ligament and helping a lifting effect, for a lifting effect. So here are our point of injection. So our aim is like to have this V shape to lift, and of course, as I told you before, we need to sometimes combine with fillers to help to have the V shape, like for example, the chin that I will show you later. So we have 2 molecular weight to allow me to treat all the skin layers because I want to have a thicker skin. I want to have a thicker skin and give volume. So that's why I'm working on all the layers of my skin, my dermis. That's why I have 2 molecular weight. I have 50 milligrams of hyaluronic acid, which is a lot, and 20 milligrams of 3-helase, which has, if you want to summarize, enzymatic degradation, protection, prevent transepidermal water loss. So it will help me to keep water maximum possible. Then my high concentration of hyaluronic acid will allow me hydration, volume, glowing, skin texture improvement. So this is our main point. Let's see some video, but we will do our workshop later. So your point shouldn't be exactly where I showed you. You will have also very good results still, and you inject with a needle. I inject in the dermis. So when you see the papilla, it means that I'm injecting in the dermis. Okay? When you don't see papilla, you're injecting in the subdermal layer, okay, and in hypodermis. You need to see the papilla, okay? And the results are amazing. Almost an immediate lifting effect. That's because of the high concentration of the hyaluronic acid. So now we will talk about the method with the cannula. You can use also the cannula to use the same product and the same technique. Using the cannula, I use in this case 23G cannula with 1 entry point. What is the purpose of using a cannula for patients who don't want bruising? They want an immediate result. They don't want any sign after the treatment. And you can use it in five lines. Or you can also like draw your point and one entry point from the middle face, and you can achieve your point with the cannula. It's exactly the same technique, or a fan technique as you saw like this. The injection technique, let's talk very quickly about the injection technique just to see which layer you are and so on. Can I have a glass of water? Posso avere un bicchiere d'acqua? They all left. Okay, so I wanted to show you also the nappage technique. I really love the nappage technique. You can use it with the V2. It's a little bit painful, honestly. And usually I combine it with an injectable intradermal injection. Okay, so let's see how you can reach every layer of the skin with the angulation of your needle and also with the length of the needle. So epidermal layer between 32 and 34 G. It should be 8 millimeters, not more, but less than 10 angles to surface. It should be extremely superficial. Grazie mille, caro. Sono andati via tutti. Grazie mille. Okay, so it should be less. You really need to inject very superficially. You need to see the very superficial papilla. The epidermal layer, the angle should be around 30 degrees. Honestly, the needle, it doesn't matter. Of course, smaller the needle and more superficial you can be. The dermal layer, you need to be between 30 and 45 degrees, okay? But you will learn this, with your experience. You can't let be like calculating the exact angle. Superficial subdermal, you are on 45 degrees. The length of the needle should be a little bit longer, like 8 millimeters at least. And when you are on the subdermal, the angulation is 60 degrees. So let's see a very short video. So this is extremely superficial. This is epidermal. You see, I'm using a 32G needle, and I'm on 10 degrees, extremely superficial. This is epidermal, okay? And especially in the periocular area, you don't have choice. Usually, you are almost epidermal, or you can't be in the dermis because it's the dermis there, it's very, very thin. Okay, so this injection, for example, it's subdermal. You are at 45 degrees. You have a needle 13 millimeters, 30 G, and you don't see papilla. So it's subdermal. And you enter almost 8 millimeters the needle. Of course, with the cannula 22G, you can't be on the dermis, obviously. You can't only be on the subdermal layer because even you can't see the cannula. Otherwise, the cannula should be 27, but a 27 cannula, it's like a needle, and it's very painful, and it can give a lot of bruising. So this is a small papilla. We are on the epidermal dermal level in that case. So let me show you the injection technique I use when I use the vitamin C, the glutathione, and so on. When I have a pigmented area, I'm injecting with the needle 4 millimeter. So like I'm on the dermis level, okay, dermis subdermal. Then I will do some nappage technique, okay. If you do some nappage technique, please do it with a short needle, not a longer one, otherwise the needle will change and it will be very painful. So this is my injection on the pigmented area. So I'm injecting vitamin C and glutathione, which will give me a brightening effect. And then I use microneedling with the same product. So in that way, I will work on all the level of the skin. Okay, so this is some result that you can obtain. This is we showed you before with the V5, the V5, the lifting technique. This is with the choline. You know, when you inject it around the eyes, it gives you this immediate lifting effect, and it's really amazing on the skin texture. Here are some other results that you can obtain. Okay, so you need to combine, in this patient, I didn't use, of course, only the V5 or any of our skin booster. I use also the Nefertiti lift with botulinum toxin. So I used only 2 methods. No fillers in this case, nothing. Just I use the V5 and I use the Nefertiti lift, the botulinum toxin, to inject the platysma, to block the platysma. This patient is 60 years old. Of course, please don't post her on Instagram. It's a very important patient for me. And I have her since 10 years. And if you combine like my technique like this, you might have, so she looks now younger than 10 years ago when I met her. She's 60 now. There are some results you can obtain on the neck, which are really very interesting. Okay, so now let's go to our new product, which is the V10. Let's talk the V10. Some of you have some experience with polylactic acid? Yes? Okay. How do you find it? You inject it for face, neck, body? You like it? Amazing, huh? Okay, perfect. What is the problem that you have found in general? Did you have some granuloma with time? No, nothing. Okay, perfect. Amazing. So, honestly, the polylactic acid, we are not the first one. It exists on the market since years. Only the skilled doctor can use it because it needs a type of learning. It needs just to follow the right procedure, like massaging well, but we didn't like it before because we needed to leave it for 72 hours in the fridge, prepare it with the patient. Sometimes the patient wasn't coming because she had some problem. So that's why I didn't like too much to use it. Now we have a technique. We have our vortex, which will mix it immediately and give me the product ready in few minutes. So what is the composition? It's 150 milligrams of poly-L-lactic acid, okay, 90 milligrams of sodium carboxymethylcellulose, and 125 milligrams of mannitol. So the preparation, very easy. So we have a preparation for face, we have a preparation for the body. The preparation for the face, I like to put more saline. Okay, you can put some sterile water or some saline, 8 ml of saline, 2 ml of lidocaine, and spin with vortex, 2,000 throw per minute, per 3 minutes. So it's really easy to use. So you're gonna fix your centrifuge, your vortex. Then you're gonna spin, you're gonna prepare your 8 ml of product. And spin it. It's very easy. It's not like PRP. PRP is much more. Just you just spin it. It allows you to use it immediately. That you will not wait all this time, three days in the fridge and so on. And you know, honestly, I don't like to leave product when I open it in the fridge for 3 days. I'm very focused on the sterility, on the, so it's a perfect method for me to get it ready immediately. Okay, so injection technique, of course, you need to be deep. You need to be usually at least on the subdermal. Otherwise, you're going to have this blanching effect immediately because the color of the product is white gray. Okay, so inject deeply. The only way to be sure that you are under the dermis on the subdermal is to use a cannula, 22G cannula. You're going to be sure of that. Then you need to stretch the skin in the opposite direction of the injection just to be sure that you are on the same layer, that you will not mistake layer, and because the cannula sometimes, can go more superficially. So the way you need to stretch the skin and massage periodically during the procedure. So while you are doing your procedure, you need to massage it to ensure a perfect distribution of the product. So it needs to be perfect. We don't want to have any granuloma, any overcorrection of some area respecting to the other. Avoid injecting superficially, as I told you, the area treated, otherwise you're gonna have the blanching effect. So my point of view, I don't like to inject the temporal area. This is my point of view. There is some area that, for me, doesn't make sense. They say that they inject the temporal area to have a lifting effect. It doesn't change anything. Why should I inject in such delicate area? With so many, like the temporal arteria, superficial, the deep temporal arteria connected with the ophthalmic area. It's a so dangerous area. We never inject here. So this is my point of view. They can do what they want because they need to find more places, of course, more area on the skin to use more fillers and to sell more. But for me, the temporal area doesn't make any sense. Will not change anything. Inject the lifting point on the zygomatic area, you're gonna see the amazing lifting. Amazing. Inject the chin, it changed everything with just the injection of the skin. Why you need to inject here? Why not just the frontal area because you have some depression? Please, we need to be wise. We need to think about. We need to just to follow like sheeps, what they're doing, what they're like. We think we are doctors. We have been studying years. So please be conscious when we just treat. Doesn't make sense. They will not lift. The temporal area will not lift anything. We have to the eyebrow. Eyebrow will not lift with temporal. Do it with the botulinum toxin. Anyhow, so I don't never inject the temporal area. I inject the zygomatic area, as we will see, and it's more than enough. Zygomatic area, malar area, it makes sense. Okay, the jaw and so on. If you have a really an important aging and elastosis of the skin. So what are the results? Volumizing stimulator, so we have volume, lifting, tone, improvement of skin texture, and if you have some fat atrophy, for example, for the patients who are very slim, who have some oncological issue, I know it can be contraindication, but I don't mind to use it honestly. If they are well stabilized, I can use it also for people, you know, they lose a lot of fat, so they need it. They are needed, or also HIV pathology immunodepressive, and so on any scars correction, it works amazing on the collagen. 3 sessions every month should be more than enough, and because you begin to see the results honestly after 1 month, and the maximum result you will see it after 3 months, because it's the time that to stimulate the collagen. So in anti-aging, we usually, or we want lifting or volumizing. Right? With the PLLA, with the V10, we have both of them, lifting and volumizing effect. So that can be really amazing as a result. So the particle size is between 30 and 60 micrometers, which is the most important, and we have homogeneous suspension. That will give us a homogeneous result. The dilution protocol for the V10 for the body, when you use it for the body. So you're gonna use a little bit of saline solution. You're gonna use 10 ml of saline solution, 2 ml of lidocaine, 2 persons should be enough. 4 ml of V-body, you can add it, for a total of 16 ml of product. Of course, on the body, you need more volume. And remember one thing, the dilution depends on every doctor. You customize in base of your experience, in base of the result you want more volume. Of course, more diluted is, little bit less effect will be, but at least it will give you an homogeneous results, okay? So don't worry about there is no fixed protocol. It's up to you. You're a doctor, you do your experience in base of the patient. The injection, yeah, yes. Yeah. How you use it? So you know that you have this transducer between one syringe and the other?
So you take it in this
Yeah, exactly. And you mix it. You can take even 20, a syringe of 20, 2 syringes of 20. Take in one, this should be the same size. Into the transducer, you mix it. That's it. Yeah, yeah, yeah. You needn't to mix inside the bottle. You can mix everywhere. Okay? No worries for that. Yeah, but it's a clever question because the bottle is small. Clever question. No worries for that. You can already, for example, take 10 ml of saline in a syringe of 20 ml and do everything in that syringe. Okay, the area that you can treat all the body. You know that it's absolutely safe. You can use for face and body. And this I made like some product comparison just to show you all the products on the market. The most famous one is Sculptra. And as you see, the results and the composition are almost the same. And of course, it exists for so many years, so we can't compete with them. But the only thing we know that we have the same particle sizes of PLLA. We have the same. It's extremely safe and very homogeneous. Okay, this is our composition. So in this case, you see the cannula which going in the temporal area. As I told you, I don't inject in the temporal area, but it can make sense to inject near the retaining ligament. The side effect that you can see in some publication, you can see granuloma, you can see some inflammation, of course. That's why you need some edema, long-lasting edema. That's why you need to use the right product and the safest product ever. So I like to show this technique of Brazilian Botox that I use with hyaluronic acid, okay? But you can use the same technique with the V10, with the polylactic acid. Of course, it will not be suitable for all the patients. As if the patient, they need a lot of volume, it will not be suitable for them. It will improve the volume, like increase the volume, not as much as a hyaluronic acid, but at least you will use much less product and it's safer than hyaluronic acid. So the implant which have been used in past are silicone, fat transfer, or now we are injecting a safe product, absolutely resorbable, which is the hyaluronic acid. Billions of treatments have been done in 2020, and it's increasing for the Brazilian Botox. So it's a very request treatment, no? How many people they want lifting of the Botox without, sometimes with volume, sometimes without volume? I guess almost everyone, right? So the injection in gluteal area should be superficial, in the medium or superficial subdermal level, like hypodermis. You shouldn't be deep, otherwise you have the gluteal artery. So the safest method is of course a superficial, like you need to be on the medium superficial hypodermis, like subdermal layer. Upper the muscles, you know that all the arteria of this area, they go on the muscles, on the gluteal muscles. So of course you need to shape in base of is a man of a woman to have very, how to say, very natural result. You need to respect the anatomy, it depending of a man of a woman. Okay, the Botox gives the idea of fertility. That's why it's important in our culture. You need to use a biocompatible and biodegradable. The physical examination is important. And let's see the drawing you can do. I usually enter, as you see, so the Ripper point as an horizontal line passing through the upper margin of the intergluteal sulcus to the mid-gluteal vertical line, okay? So we're gonna draw two lines. Then another line from the upper margin of the intragluteal sulcus to the greater trochanter. And then we have our entering point. And then we will draw a vertical line, which is 8 centimeter lateral from the midline. Okay, you need to account, but of course there is no science. It's like our experience, which allows you to do this drawing. And then this line from the anterior iliac crest and the sacrococcygeal joint, we will draw my entry point. I will begin to fill this line, and then we'll do on a fan technique. So this is my design. I was with a colleague doing that. And I will say 7-8 centimeters, but of course it depends on the shape of the patient. It's absolutely can be personalized perfectly. And I will fill this area, and then we'll go on fan technique. When I use the polylactic acid, I will, of course, treat all the area where I have a little bit of cellulitis, a little bit like irregularities, and I can even do many entry points, not only one. This is the technique with filler that I have been then transmitted and working with the same technique using the polylactic acid. Usually, I use a local anesthesia. I inject almost 10 ml of local anesthesia. I combine lidocaine with saline. It's like the Klein solution you use before liposuction. The same exact before I do my anesthesia, because it's a bit, honestly, it's a bit not very comfortable treatment. So I like to do all my anesthesia before. So this is the injection of anesthesia. In this case, I'm using a long needle. It's not a cannula. It's a needle to do my anesthesia. And did you see the depth? I'm in a medium superficial hypodermis, okay? And if you see one thing, you see that the direction of my needle, it's lateral, because the gluteal arteria is medial. You need to avoid this area. This is the most dangerous area. That's why my entry point is medial, go laterally, and it goes laterally, okay? And of course, for the injection, I will use a cannula. So this is the safe part, superficial hypodermis, superficial medium, deep subcutaneous layer. Never go on the muscles. We have seen a lot of necrosis, very important, because it's all related to the iliac arteria, which go to the aortic arteria. So it's really very dangerous, the gluteal arteria. Some injection on the muscles, and they give a lot of problem. So if we are injecting, we can be also on the superficial subcutaneous layer, not only the median of deep. So with the polylactic acid without problem. Okay, so this is my entry point. Of course, I inject some Klein solution containing adrenaline on my entry point that I already draw. You draw, please, you do your drawing when the patient is standing up. Of course, not lying, because it will change everything. Then I'm injecting my hyaluronic acid in this case, but I will tell you the problem. The problem of the hyaluronic acid in the gluteal area, it can give infection. More vial, more product you inject, and more risk of infection you have. And honestly, personally, I already had infection with hyaluronic acid, because it's a molecule which attract the bacteria, and you need to be extremely safe. But even if, like the patient, you have all the sterility and everything is going perfectly, you can still have infection and many problems. So that's why I like now to use only the polylactic acid. So you need a gentle massage, give some painkiller, and just to give you an example, to get this result, you need 10 ml. It's a lot of product, a lot of money for us and for the patient, a lot of 10 vial. That's why you can obtain a good reshaping, good lifting effect with polylactic acid. This is the new trend, like feeling less volume and having the maximum lifting and the maximum results. So let's avoid the complication, please. What about Kim Kardashian? Do you think that is it real or no? I don't think so, huh? Of course no. But even if she's claimed that it's absolutely, I did some tomography, I'm perfect, I'm natural, but I don't believe that. That's natural. Okay, so let's talk about V20, and we're almost done. You can go to have some lunch. Okay, so the V20 is very interesting because we have a high concentration of hyaluronic acid. We have 2 ml in total and 2 molecular weight, 1,200 and 1,500 kilodalton. The protocol that I do is 2-3 sessions every month. I'm using this protocol also for the patients who don't want to come so often. Even after the first session, they have results. And then I repeat after 6 months just to maintain the result. So the injection technique with needle, with cannula, or both of them. But I think in 2 ml, you can use only 1 ml, for example, with cannula, and the rest of the ml with the 5 lifting point. The result is an intense stimulation of collagen and elastin fibers protection, intense water binding, which gives a long-term hydration to the skin, and it gives tone and skin firmness. Okay, the composition of the V-body, this is the last one we are talking about. And then I hope you remember VA, V1, V2. I will then ask you, what's the composition of the V2? Otherwise, you stay in Milan. You stay here, you're blocked. Test, evaluation test. Okay, so the V-body, it's easy. We have the fragmented hyaluronic acid, as we said before, which will stimulate the CD44 receptors, amino acid complex, lysine, glycine, proline, because we need more for the collagen than for the elastin on the body. And then the results, or stimulation of fibroblasts, tone, skin firmness, because building the extracellular matrix and protecting it. Technique of injection now, you are the master of the skin booster injection. You don't need any teaching about this. The protocol, 3 sessions every 3 weeks and repeat after 6 months. You can remember, mix the V-body and the V10, which is the polylactic acid, for the body. So the result is a lifting effect, moisturizing effect, induction of collagen type 3, which is the young collagen, the one, not the fibrotic collagen. Then biostimulating effect and skin tightening. I think we are repeating exactly the same things. The contraindication, pregnancy, breastfeeding, because especially the breastfeeding, because we don't know if anything happens, not because it has some side effect, but if anything happens, we are responsible. In fact, tomorrow I have a pregnant woman. I'm thinking what I will do for her. Maybe only PRP, because I'm scared. Okay, so the allergy, usually the patient don't know if she's allergic of some component, but usually it's very safe. We did all the tests. It shouldn't cause any allergy. And then if you have acute inflammation, it's better not to use it. I showed you already 2 techniques to reach the malar and zygomatic area. So we have 2 entry points. You can enter from the higher zygomatic area, or otherwise, what I like also to enter. I do, I draw, I'm using a 23G cannula. The length this time is 7 centimeters, but 5 centimeters is enough if you need to treat a small, short, like face. Otherwise, you lose product. Why are you laughing? Because he was having pain, right? Okay, so as I was telling you, if you treat only the zygomatic area, you're going to have an amazing effect, amazing. You can do it in 2 ways. So this is another patient I'm treating. This is the drawing I'm doing that you will see during the workshop today. And my entry point, I always treat the malar area, and I am subdermal in this case. The result should be immediately visible. The lifting effect should be visible. I just love it, this technique. When I enter from the submolar area. I love this technique. It gives the immediate results. Let me show you very quickly, and you're done, my Texas technique to define the jawline. I love it because I have been working in Casablanca in Morocco, and we have a lot of requests. Middle East, Casablanca, Morocco, like north of Africa, they love this angular, this very masculine type of jawline. So this is my Texas technique. Why we call it Texas? Texas is because of the shape of the geographical card of Texas. It's L, simply L. It's like angle of 90-degree angle. Non abbiamo quello per passare le diapositive, vero? Tanto lo devo collegare, fa niente, fa niente. Ok, quindi if you see Angelina Jolie with Photoshop, of course, without her jawline, it changed everything on her face, right? Sometimes the jawline is so important. I try to achieve, for women, neutral angle between 120 and 130 degrees. The Asian women, they have a large angle, which more than 130, but the request is to have a narrow angle, less than 120, like almost 90 degrees as the men, masculinized. But it doesn't fit all the women. You need to advise them. I will show you some cases, they don't fit. It doesn't fit to them. Like you see Angelina Jolie with now her ex-husband, they have exactly the same mandibular shape. It fits to her, but it cannot fit to anyone. This is the most famous, beautiful models and so on all over the world, and actresses who have this very angular shape. So it's a fashion trend, right? Yeah, to answer the beauty standard coming from American and Arabic beauty. And it's more than influenced by social media. It's less request in Europe country, honestly. In Europe country, it's just to go until the aging, until the sagging of the jaw area. The demanding patient, as I said before, for example, this patient, she was insisting in Casablanca, in Morocco, she wants to have a square jawline, but it doesn't fit her. She looked even worse than before, honestly, with 6 ml of product. So please be conscious and try to advise. We shouldn't be slave of our patient, giving their request whatever they ask. So let's see a very smart technique using a small quantity of hyaluronic acid. So I use needle. I'm injecting the anesthesia. Okay, in that case, I will use needle on mandibular angle. I draw the facial arteria, so the dangers. I have two techniques, needle and cannula. So always aspire, even if I'm on the perios area, there is no vessels there because I'm far from the facial arteria, but still, please, at least for a few minutes, not few minutes, at least for 10 seconds you need to aspire, and the needle should be clean. If the needle already has hyaluronic acid, it's difficult to have blood, okay? Then inject very slowly, small boluses, no resistance. Okay? If you feel any resistance or anything, please stop. This is very important. It means that you are injecting inside the arteria, even if we know you can feel the arteria. You have the masseter, the angle, the anterior angle of the masseter. You can feel the arteria because you have a hole here where the arteria, you can feel it, so you can avoid it. My second entry point on my chin, I'm using a 22G cannula. I use the adrenaline, anesthetic with adrenaline for the entry point. I will explain you why she's bleeding the patient then, because I didn't wait. When you use adrenaline, wait at least for 5 minutes before inject. Otherwise, you have more bruising than before. The adrenaline is supposed to avoid the bleeding. So wait at least 5 minutes. I'm injecting. I'm the subdermal layer. I'm not deep. I don't need to be deep because this area is more dangerous, more delicate. So I will not use needle here. I like to use the cannula and injecting very slowly. In total, I have injected 1.5 ml, and she had an amazing result, I will tell you. So be parsimonious. Don't inject a lot, especially in young women. You can inject also the chin with the same method. So just wanted to show you how you can achieve very nice results without injecting. So look, you can use now the result. You can see the result. They're really very nice, and you have a very good definition of the mandibular area with only injecting 1.5 ml. Here is also the needle technique. In this case, I used only needle, no cannula, and only 1 ml each side. In total, 2 ml, and it gives a good result. Most important, don't inject too much, like the minimum possible, otherwise it's gonna be heavy. So my technique for the chin is everything for the V shape. It's so important. Sometimes you just inject the chin and all the face changes. You have already the V shape. And of course you can inject also with cannula and define better. In that case, you needed only the chin and it changed. This is the before, and I hope you understood what is the before and the after, because sometimes you can't see it in some patients. Be careful, please, on the chin area when you use the needle. We say that it's safe when you are in the periosteal, when you are deep, you don't have any problem. That's not true. There are some connection with the lingual arteria, and not in my case, thanks to God, some colleagues had some necrosis of the lingual, of the tongue. So inject small quantities, maximum 1 ml at time on the chin. Otherwise, use the cannula. Okay, so this is the cannula technique as I showed you before to define the jawline. This is I already showed you. So look, this patient, how only injecting her malar and zygomatic area on the chin, how all her face changed. The shape changed completely. She's absolutely more triangular. And even in this case, injecting the chin, injecting the zygomatic area with the cannula, you can see that the shape of the patient completely changed. So we are almost done. We're almost done. Fantastic. We are on time, right, for the lunch. So let's see some comparison with other products already on the market. So we can compete with the most famous product on the market. We have the best quality, the purest hyaluronic acid, the best technology, and is made in Italy. So it's not because we exist only since 2020 that we don't have the experience, but we have been researching for years for that technology to get the best for us and for our patient. Because first of all, safety, more than anything else. And then comes the beauty, comes the harmonization of the face, and so on. So welcome to Italy. I hope you enjoyed this at least theoretical part. No one is sleeping, so I'm very happy for that. So for me, the preparation of the patient is very important. Please remove the makeup. Better to ask your patient to remove the makeup even before she comes. You know, we don't want to be there like at least 5 minutes to remove everything. The skin needs to be perfect. Perfectly sterile. Remember that it's a medical implant, subdermal implant. I mean, everything should be sterile and perfect. So it's almost like type of implant. So please be careful of sterility, like disinfect 1 time, 2 times. I like perossido di idrogeno. Chiudi gli occhi. Disinfettami bene questa parte, fantastico. Yes, it's very important. I like to use the peroxide hydrogen because it has also anti-bleeding effect. Like it it gives a vasoconstriction. But you can use the chlorhexidine or anything. Okay, so after an accurate disinfection of the patient, so this beautiful patient from Lithuania, right? Yeah, coming from Lithuania, they have a beautiful story about Lithuania, so that's why I had some, I'm linked by heart. She wanted to treat the peri-oral area. Okay? So we will focus on her peri-oral area. So we will use the VA. We want a conservative way. We want a natural way. We don't want to inject in this area any filler, any other, probably some substance which can give me some side effect, right? So we will use the double technique, as I told you before, cannula, and also the papula with needle, so the classical technique. So my injection point, my entry point will be exactly here. My first entry point for the tear area with my cannula. If you have ready the adrenaline, and mi metti un ago per favore da 30G o anche trovi degli aghi piccoli, anche da 32 di qua o di là, li cerchi. O 30G va bene. Okay, so when you're using some anesthetic containing the adrenaline, ask the patient if he has some heart, any heart issue, okay? So arrhythmia, if she's taking some medicine and so on. So are you okay? So I can use some adrenaline? Because adrenaline can give increased heart rate, and it's not like you need to ask that, it's very important. Even a small quantity of adrenaline. Otherwise, use only lidocaine. So I will inject, prepara sempre delle garze per favore con l'antisettico. Small amount of anesthesia on my entry point, okay? You need to see the papula, really very little, just 0.1, just to make the treatment more comfortable. 0.1, sorry for that, my dear. And of course, ask the patient if she has any issue with any allergy to the anesthesia. You know that lidocaine, it's a bit, it's not natural product, it's a bit toxic. So less lidocaine use and batteries. So you're fine, you already had some operation before and so on. Perfect. Okay? Perfect, so I will keep them here. Then, prepare me, please, VA. We will use the VA, so we need have the best product for the periocular area. So I rather will use small syringes, 1 ml, okay? Prendi uno grosso per prelevare, perfetto. And I will take some VA. So before any, with your disinfettante qua, giusto? Okay. I always disinfect, even if it's absolutely sterile. Before taking the product, I always disinfect. Evertilo, aspetta, fammi fare. Evertilo, bravissimo. Okay. Then, my cannula. And remove the air from the syringe. We don't want to inject air. Be careful of this small thing. Everti la fiala per prelevare. Posso avere anche una pattumiera vera, solida, per favore? Dove mettere se è possibile? Posso avere una pattumiera? Fammi fare a me, pure se hai qualche dubbio. Lascialo dentro. Dammi il cappuccio, Eugenio. Lascialo dentro. Fammi fare a me. Okay? Quindi, so we have the product also inside. We have the air inside the cannula, so be sure to remove a little bit the product. Non lasciare mai così gli aghi. Scappucciali, chiudili. Allora, I dammi le regards. Perfetto. Okay, so we already inject the anesthesia on the entry point. Vieni Eugenio che ti do l'ago poi. I will do my entry point. Tienimi il cappuccio. Poi quando dito l'ago lo metto dentro e mi dai questo. Ok, quindi I will do my entry point from here. Ok. Then togli l'ago. So be sure also to squeeze the skin like this. In that way you don't have any bleeding. And here, of course, you can be superficial, you can be deep. What do you think here, where I am? I am superficial or under the orbicularis muscle? I'm superficial, right? Because I can see the tip of the canal. Sorry if it's a little bit painful. And we'll inject very slowly. How do you feel? Fantastic. I will inject very slowly. So here, of course, you need to be superficial using the VA, and it's very liquid. The reason why I'm using a 22G cannula, it's really safe. It will not give you any bruising. So I will use 1 ml for each eye. The rest, I will inject it with papula. So I'm already on. You know, you can have even a little bit overcorrecting without problem. We don't need to go deeper. You can do also technique sandwich. How do you feel? All feel? Fantastic. And also choose well. The quality of the cannula is important. It can give pain. Now I'm deeper. See? You don't see? Yeah. Now you can stretch, for example, the tear trough ligament. How do you feel, dear? You're okay? Yes, please, if you feel any. And please, if the needle has that direction, like toward the eye, protect, keep always one finger on the periocular area on the bone to protect. You never know. The patient can move, she has pain, and the cannula can go through the ocular globe. Like, I mean, it can be really dangerous, okay? So now the direction of my cannula, it's parallel to my eye, so I don't have any risk. So I did a sandwich technique to sustain the tissue in this area. Because usually when you use the needle in this area, it's very, you have bruising, at most, almost all the time. Okay, you can see already the feeling. Now I'm crossing the zygomatic muscle. I want to reach the lateral area. Okay, so the cannula from this area is done. We're gonna have more 1 ml, okay? If you can feel it, please. And as we have, you can massage it for a better distribution. Okay, you can see already the feeling effect, and of course, it will be absorbed in the next hours, maximum tomorrow. Okay, how do you feel? You're okay? Perfect. Okay, sometimes when you have some lidocaine on the product, the patient has some trembling, like some with the eyes, how you say, ha delle, come dire, tremors on the eye. Sorry, sometimes I confuse with her. And it's normal, don't worry for that, just because of the lidocaine effect. Okay, so we will do my second entry. You can see the papule of adrenaline. The nice thing to use lidocaine with adrenaline, you can see where you can enter directly the point because, of course, you have the vasoconstriction. It's white, so smoothly. I punch always the skin for my, it's instinctive to have the vasoconstriction. If you don't have any adrenaline, you can just punch the skin, have the vasoconstriction, and do the entry point. Okay? The same method you use for fillers. Okay, if you want to use the S, for example, the S plus in this area, or the soft, you can use the exactly. Perfetto. So you don't need to remove the product to remove the air because we already used the cannula from the air. Yes. Grazie. Of course, we not have almost no bleeding. How are you? Are good? Fantastic. So now I'm superficial. I will inject slowly my 1 ml. Dimmi se poi nascondo con le mani, ok? Perché a volte senza riflesso. So, remember, if you need to go from down and the direction of your needle is toward the eyes, how are you, dear? You're okay? Okay. But you have a little bit of tears because I'm disturbing you? Okay, fantastic. Okay, and you can be more superficial and a little bit more deeper as a sandwich effect to sustain this area. Okay? Still, remember to keep a finger here on the periost, just to protect in case. And I'm a little bit deeper. I inject slowly. So the technique is whatever product you're injecting, inject it slowly, please. To see the reaction, to see the results. Never inject anything very fast that you can't see the consequences after. Okay. Then I will inject a little bit the lateral area. Are you okay, dear? Yes. Fantastic. We have the best patient ever. Then you will change me the gauge. Okay. So actually, before I was ophthalmologist, so the eyes is my favorite area. And there is only one thing. Whatever procedure you're doing, especially when you're doing some peeling or some superficial procedure, ask the patient always to close the eyes. You don't know, you have some lidocaine in your hands and it's squeezed, you never know. Always the patient with closed eyes. I like to work like this. And always to have a finger to protect my miraculous organ. Okay, so this area is done. Perfect. Now we will use some, thank you very much. Chiudi la cannula. E adesso, now we will inject it with 1 ml syringe. So why I'm using and one small needle, maybe you can find some, puoi trovare un 32G che trovi o dentro lì, bravissimo, è un grigio chiaro oppure un rosa. 4 mm, bravissimo, ok. This is 32G, carica della siringa da 1 ml e facciamo le iniezioni. VI, yes. Tutto ok, cara? Everything is good? Ti sto parlando in italiano. Okay, so this is the part with cannula. This method I'm showing, you can use it with any filler. So usually I use the S for this area. You can use it anytime you need to combine, if you want to combine skin booster with cannula and with needle. So my entry point is almost like this, except when I need to feel also the jaws, the zygomatic area and the malar area. So my entry point is lower than that. Of course, now I want to focus on non bagnare troppo. This is just disinfection. Non bagnare troppo, per favore. E qua c'è un casino per la spazzatura. Sistemala meglio, per favore. E non mi bagnare troppo le... Okay, now we will do our injection point with 32G needle, 8 millimeters. That's very thin. As the product is very soft, you can inject it without problem. See how many times I'm disinfecting many times. So I will go around in the periocular area. I will inject very small, close your eyes, please. Very, very small papilla, very superficially. Sorry, is it painful? Yes? Little bit? Okay. Very superficially. You're okay, dear? All around the eyes, all the periocular area. So sorry for you. Since you are on the dermis, on the epidermis, in that way, you don't have any risk. There is no arteria on the superficial level on the epidermis, so no risk. And even if we inject it, it's better no. Inside directly, a big vessel, inside the arteria, there is no risk because it's not, it has a very low molecular weight, like it's dissolved immediately. How do you feel, dear? Yes, perfect. I keep asking you, I know, it's like this with all my patients. Open your eyes. Was it painful? No. Fine? Normal. Okay, this is, the reaction is normal, huh? Okay, close your eyes. And on this area will be very little bit because it's, usually it's bleeding always because the skin is so delicate here. So very small. Okay, then, of course, you can go all over around. There is no contraindication to inject all over around the eyes to stimulate the collagen in this area. And avoid, the patient, you need to ask her to avoid any anti-inflammatory steroid, anti-inflammatory, to avoid any, like the aspirin and so on, which will enhance the blood fluidity and give me more bruising. It will be better if you use the ice. If you use the cold around, it's amazing. Okay, perfect. This is done. Riempimi un'altra siringa, per favore. E che la spazzatura questa volta la mettiamo tutta qua. Fantastico. Okay, so we'll do the other eyes. The other eye. Yeah, sure. Dammi una garza asciutta. Sono tutte bagnate questi. Dali questo. Yes, dear. Sorry that I made you cry. Ok, non bagnarli, sempre sono un po' bagnati. Metti meno, per favore, meglio la spazzatura, perfetto. Mm-hmm. You're okay? Okay. Perfect. Be careful to remove the air always. You need to be very superficial. The needle is very thin. It's 33G. So, but it doesn't mean that she will not feel anything. Even with the thinnest needle, she can feel something. It's okay, my dear? Se hai un altro ago come questo lo cambiamo. And change often the needle, because more you inject with the needle and more it become painful because of the tip of the needle. Thank you very much. Grazie mille. Te lo do a te. You're okay, dear? Fantastic. Okay, if you see, I have a finger always to maintain my syringe. It gives me more stability and the patient has less pain. Right? Because you're more stable. Okay. So, the treatment around the eyes is done. C'è qualche garza sterile, così. Perfetto. Ok, e poi I would need la crema antibiotica, qua, la fusidine. Yes. So, it's not so invasive. So, this small papilla that you see will disappear in few hours. And you know that because the product is very liquid. Possible small bruising can appear. This is, of course, sterile one. And after that, I will apply as just prevention. You're still tearing? Yeah? You have some tears still? But it's fine now. Fantastic. Okay? Just some antibiotic cream. Even if I have also post-procedure cream from Infini, I think I have it. But before we will apply some antibiotic cream just as a prevention. Of course, it's not obligatory, especially on the entry point that I have used. So I have the Regeneration Absolute from Infini, which contain all the anti-inflammatory, naturally, arnica, and so on, that we can apply nil immediate after. So you know that the skin under the eyes is the thinner possible. You don't have, it's the thinner of all the body. That's why any injection you do, any treatment you do, you can see it immediately. Can you look up? So don't worry if the left eye seems like more filled than the other, but it doesn't matter. It's just a question of volume. It's absolutely liquid. It's going to be resorbed. It's not a filler. So we don't need to worry about any asymmetry because we inject more from one part to the other one. So, as you saw, the treatment is fast. And we can ask the patient to come back after 2 weeks and do another second session, then after other 2 weeks, and then the third session. And recall after 6 months almost. Okay? So, amazing. Perfect. So what is a recommendation? Avoid makeup for the next at least 2 hours on this area. And she can do anything she wants, especially for the entry point. We needn't use any makeup because we enter with the 22G cannula. We have a hole still. It needs 1 hour to close up completely. So don't remember what. Soon as you use the cannula, please, to apply some antibiotic cream immediately after. Okay? And avoid, with the cannula, you can't be too much deep. You know, we have or arterial nerve that you can little bit trigger. With cannula, you can't damage anything, but you can trigger the infratrochlear. Okay, dear, you're done. And I hope I can treat you more next time you come. If you want other area of your face, with pleasure. I would do, I would do shape your lips just all with the Russian technique, just to give them some shape. So what I can do else on your face, you look already amazing. Maybe a little bit more projection of the chin. If you can see her, can we see her from profile? Can you see? No, she needs to sit. Ok. Focalizza su di lei. Ok. Sul profilo. Tutta. All. Turn all, please. Perfect. Like this. Yeah. So, look. If you see the profile, she has a little bit of chin. If we project her chin, not only her mandibular line will seem more lifted, but also her nose will seem smaller, and her profile will be more harmonious. Like one injection point will change everything. And she would need also some, can you do like this? Okay. She will need also some botulinum toxin on her chin. Sometimes only with botulinum toxin, 2 units and 2 units, I can show you the point. Please come here. It can already give the projection of the chin. I will show you the point that you can do with botulinum toxin. So you can do like this, please, with your chin. I will show you. You wanted to see also the Nefertiti lift. She's the perfect. In fact, she asked me about her neck. I told her, you need to perform Nefertiti lift with botulinum toxin. I will explain you everything. But first, let's do her chin. So her chin, it has this type of orange cellulitis, like on her skin. So I will do 1 point here. You know that the chin muscle, it has 2 parts. It's divided in 2, okay? So we'll do 1 injection here deep on the muscle, 1 other injection here deep on the muscle, 2 units and 2 units. To begin, if you see that it doesn't give the results after 10 days, she come back and you add 2 and 2, because the muscles, the mental muscle is very strong. It gives like perpendicular. You go perpendicularly on the muscle like this, and perpendicular here on the muscle. Like use a 13 millimeters. Not on the periost, until the periost. If you inject all the 13 millimeters, you will come on the periost. A little bit less, really on the muscles. Okay, let me show you the Nefertiti lift technique with the botulinum toxin. That it's amazing. You can combine it with all our skin booster for the neck. You can combine it with the V2, you can combine it with the V5 for the neck. But once you relax the platysma, everything is helps a lot for the jawline. So,
in one session we can do
yes,
yes?
you can do botulinum toxin and skin booster on the neck at the same session. Why? Because if we have diffusion, the problem to combine with the biorevitalizer and botulinum toxin, it's about the diffusion. But on the neck, we don't have any problem of diffusion, okay? Unless, of course, for the muscle of the esophagus muscle and so on, the larynx and so on. But this will not create. So on the neck, you can combine both of them. I usually did it already. Okay, but before your botulinum toxin, because you need to see the point, the perfect point. If you do the biostimulation before, you will not know where to inject. So here, how I do my botulinum toxin. So first what I inject, sorry if I go ahead, but they need to combine to have the maximum result. If you combine both of them, do you remember the woman, 60 years old that I showed you? Combination with skin booster of V5 and botulinum toxin on the platysma was amazing. So before I treat the DAO, depressor angular oris, it's connected with the platysma, so you need to treat it. Can you do like this? Okay. So normally, to be efficient, the DAO, you need to inject it at the middle here. You feel it. Do it, do it, do it. Okay. You feel it. It's exactly here. Okay. The only problem when you inject it in this real strength, it's you can have the diffusion of the depressor of the labial oris. So she can have some asymmetry. To be safe, when you use it for to treat the platysma, you will inject it at his basis. At this point, you don't have any risk. So we are talking about onabotulinum toxin, so 50 units. 2 units of onabotulinum toxin, it means Vistavex, Bocutra, and so on. 2 units here, 2 units here, and then 3 points upper the mandibular line, 3 points on the mandibular line, 3 points under the mandibular line, almost 1 centimeter. The same things for this area. 2 units each point. It means 2 per 6, 12 units. All the rest on the platysmal, because this is the insertion of my platysma, I need to block it to lift, to help my lifting. Then, can you do like this again? Okay. Every point to 1 unit, again, and the dilution will be a little bit more. You can do 1.5 instead of 1.25 or saline. You're gonna draw. Because the doctor here asked me about the botulinum toxin, the Nefertiti lift, but I will show you then a video on my computer that I have. Okay, so then you go, see how much is strong, and you go inside. Tell me if I'm hiding with my hand. Se nascondo me lo dici, perché nascondo a volte. Okay, you're gonna inject on the platysma, not on the skin, so deeply, until which go even on the décolleté. You do it. Can you do it like this again? Okay, look, it came until here. It's a very huge depressor muscles. We need to stop it, to relax this area, and then treat and lift. You can do it also on the same session. Very easy. Then the injection, it's very easy, like 4 millimeters length, and you go on the platysma. That's very easy, the injection. Okay, so that's it. And you can combine, for example, some of my colleagues, they will treat the platysma on the Venere, the neck colon, collani di Venere, colons. The neck colons, right? Venere. Venus. Venere. Sorry. So the Venus colon, they will treat, they will inject here. Give me another one. Dammi un altro, o me lo temperi per favore. So what we can do, you can do your botulinum toxin as I showed you, and then your V5 around these Venus colons. 1 centimeter between one point and another one. It is gonna be amazing. Okay? Because this, salute. God bless you. So this is how we can, so she needs chin. She need, you want to do something?
Yes.
Yes. I know that you want. You want to see the chin? Quickly?
Yes.
Okay, it's gonna be very quick. I think we have some fillers. Give me the L. Yes, exactly, the L plus. L plus. Because she came from so far, so she will be happy for that. C'è una parte qua dove puoi aprire. Qua o qua? Non ce l'hanno? Ecco, qua. Ok? Dammi per disinfettare, per pulire per favore al volo. Okay. And you're gonna see with small product how much projection you have. It's amazing, the projection you have on the chin. With the L, I'm very, very happy. Today is dedicated to the V-line. I'm not supposed to do any fillers, right, Anna? I'm not. Yes, I'm not supposed. But she wants to look nice. I can't tell her no. Okay, and then we will do the neck. Perfect. No, il 27. Dammi un'altra. Yes. Ce l'hai un po' d'anestetico anche con adrenalina? Ti ricordi che ce l'avevi? Okay, always remove the air. You can hear also my breath. This microphone is very effective. Too much. Can I breathe in silence, in privacy? No, I can't. Oh my God. I'm gonna hold my breath. Basta. Ok. Ma stai prelevando con 27? Ok, perfetto. Sai come fai se non ti viene? Devi spingerlo con questo. Queste cose non li sai ancora.
No, queste qua non le ho mai viste.
Ok, basta. Devi spingerlo dall'altra parte con qualcosa. Col tappo, ecco, il tappo della siringa, così. No, questo non va, questo tappo,
no,
ma di
ma
solito.
così lascia
Ok, vai,
bene
basta.
così, va.
Sì, dammelo. Little bit of anesthesia. Prendi questo per favore. Attento. Bismillah. Bismillah. I will do first my point in the middle. Okay. Okay, I always aspire for 10 seconds at least, even if I'm on the periust, I'm touching the periust. You're okay, my dear?
Mm-hmm.
Breathe, long breath. So inject a little bit. I'm hiding with my hands. And somehow we need to find a way. Yes, please. To show them from which side that should come. Okay. Okay. And then slowly. Okay, Cara? Inject very slowly. Okay?
Mm-hmm.
0.5. Can you see? Maybe a little bit far. And you can already see the amazing projection. So for a woman, you're going to inject in the middle, even 1 point. It's okay if she has a triangle area. In a man, you're going to inject in 2 points. Can we see her from the profile side? And I inject only 0.5. Done. And you can a little bit remodel it. Okay. I see better the projection than yourself, honestly. Yeah, here you can see the projection. Okay, do you like it? It's really amazing. And even the face, the whole shape of the face changes if you sit with only 0.5. Okay. That's amazing. Maybe next time I will show you the lifting point with the feelers. Okay, thank you very much. We will do some polylactic acid on her stomach. What do you think? You like it? Ok, let's do it. La pancia.
Iniziamo dalla pancia.
Spogliati, sì. Perché è perfetta per l'acido polilattico. Ok, Eugenio, faremo l'acido polilattico? Bravissimo. Vieni, sì. E si posso avere un bicchiere d'acqua? Dell'acqua, per favore, non so se c'è qualcuno che parli italiano. Sì. Okay, so we have this beautiful woman who is a sportive, you know. She does a lot of activity. She already had a pregnancy, but unfortunately, she take a lot of sun. She get tanned, right? We can see the skin damage, the photo skin damage, ok? Ti abbronzi tanto?
Adesso mi fa tanto.
Sì, però before a lot, yeah, this is very important, okay? So, we will treat actually this area, okay? Upper the umbilicus. You can sit, please, and we will see this area. And we will do actually 1, 2, 3, 4 entry points to cover all the area. Why you don't like it? You don't want to do it? You're like scared? Okay, so let's prepare. Let's see how we prepare. So usually, remember, you will get 10 ml for the body, 10 ml of saline solution, 2 ml of the V-body. If you don't have the V-body, 12 ml of saline solution could be nice, could be enough, and 2 ml of lidocaine. And then we're gonna spin everything in the vortex for 3 minutes, 2,000 row per minute. And ready. We're gonna inject with syringe 3 ml syringe, better in lower leg. Why are you laughing? What? You're modeling, you are like a model. Okay, you need to pay the rights for these beautiful ladies, huh? If you take them. No, you pay them because they are so beautiful and you're taking them. Okay. So 10 ml, use 18G needle. It's easier to take 10 ml.
Plus 2 or 10, 12?
12, please.
12 plus.
Yeah, because we don't have the V-body. Perfetto, bravissimo. Ok. Avrai bisogno dell'ago comunque per prepararlo. And that's it. Let's do the drawing on her beautiful stomach. Grazie mille. Prima c'ho una sete. Puoi chiedergli di portare dell'acqua? Sto morendo di sete, per favore. Freddo, tesoro, scusami. So the disinfection on the body should be very accurate. You know, just disinfect perfectly. Grazie tesoro. Naturale, vero? Grazie mille. With this beautiful piercing, it's gonna be amazing. Okay, so my cannula is 5 centimeters length. It's better to have a 7 centimeters on the body. It's gonna be
Non ci stanno
tutti.
Non ci stanno tutti.
Ok, quindi hanno fatto qualche errore. Allora, quello che farai, prendi un altro 10 ml,
Sì.
un'altra siringa da 10 ml e prendi praticamente altri gli ml che non sono bastati,
Due
li metti
circa.
qua,
Sì,
più
più
2
2
ml
ml di lidocaina che
bravissimo,
mancano,
e
esatto.
poi con questo tu mescoli, metti uno dentro l'altro fino a quando siano perfetti. E poi rimettiamo
Ok,
dentro
quindi
quello
faccio
che ci sta.
faccio shakerare metà e poi faccio shakerare l'altra metà, diciamo,
Bravissimo,
ho capito.
bravissimo.
Sì, perché mi è schizzato in faccia praticamente.
Ok, allora prelevi altri 2
Aspetta,
ml
aspetta
di
che prendo la
lidocaina.
lido.
Ce l'hai la lido? Perfetto. 2 ml di lidocaina. So, we were discussing the fact that for the body, the vial is small. It can't contain all the material because we have 12 ml of saline because we don't have the V-body. It should be 10 ml plus 2 ml of V-body plus 2 ml of lidocaine. So what we will do, it's easy. The vial is small, can't contain more than 10 ml. What we will do, so we will take the first, which is the maximum, 10 ml inside. Then we will take other 2 ml of lidocaine, other 2 ml of saline solution in another 10 ml syringe, other 20 ml syringe, I'm sorry, and we're gonna mix it with this, the locker. We're gonna mix them. Yeah, sure.
Normally, I'm Dr. Monica from Poland. Because normally for polylactic acid, we use acquaproinizione to dilute. I want to be sure it's saline.
Yeah, we can use also saline right now. Yeah, usually sterile.
Both or
You can use, you can use only saline or can use only sterile water. Okay? Yeah, you can use both. Now you can use saline also. Because we have the mixer now, we have the vortex, so it's gonna mix it perfectly. Yeah. I know that we always have been using normally water, exactly. Yeah, yeah, yeah. Ok, e lo mixi uno dentro l'altro. Poi facciamo 2 volte il vortex. Okay, so in the meantime, we will do the drawing. So I will treat the upper and the lower area, and I will have in total 4 entry points. So 1 entry point, the second entry point, because I want to answer also my colleague. Before, we were supposed also to keep it in the fridge for 3 days, you know. This is what the old method. Now, hopefully, we did the smaller particles of polylactic acid, which dissolve better. And also, we will use the vortex, which is going to help for the homogenization of the product. You know that before it was like, we are using since many years, I know that. And in that method, and it was a little bit, you know, it was an handicap to leave it on the fridge, to prepare it. Sometimes the patient will not come to the appointment, and we will have some trouble. But now things change. The particles are smaller. The technology improved, so to dissolving, to homogenize. So more I go with time, more I'm tired, with my English will be worse. I'm sorry for that. I will end speaking French. Okay, so my third entry point will be here, and my fourth entry point will be here. Okay, so...
Perché si è otturato l'acqua.
ah sì?
Sì,
Ok.
perché non aspira
Quindi
niente.
cambia ago, semplicemente. Cambia ago. Okay, in the meantime, I do my anesthesia on the entry point, which is already my lidocaine plus adrenaline.
Questi qui sono andata via se vuoi per l'anestesia.
Grazie mille. Fammi prelevare già. Abbiamo delle siringhe a insulina normalmente che sono qui. Non viene niente? Sì, perché non viene niente? Sì che viene. Sì che viene, non ti preoccupare. Tutto nella norma, tutto a posto. Ok, so let's do my anesthesia, my entry point. Sì, sì che arriva. Devi shakerarlo, shakerarlo.
Ha fatto tutta una specie di polverina sopra, quindi
Poi lo shakeriamo, tranquillo. Hai capito quello che ti ho chiesto di fare, vero?
sì, di dividerlo.
Bravissimo. E metterli uno dentro l'altro fino a quando poi lo shakeriamo. O quello che puoi fare, inizia a mettere questo nel vortex.
Sì, perché sennò non...
Bravissimo, metti nel vortex.
Non si... come dire...
Bravissimo, metti nel vortex. Fa niente, poi la lidocaina la mettiamo a parte.
Esatto.
Non ti
No,
preoccupare.
ma dentro c'è già la lidocaina,
Perfetto, dai.
Solo che va messo un po' stretto al volo.
Ok, vai. Ok, metti nel vortex. Nel frattempo, dove sono le siringhe a insulina? So now we are spinning for 3 minutes, 2000 row per minute. Dammi qualcosa per spingerlo. Vedi che entra, spingi. Questo cazzo di polilattico, tu l'hai già usato?
No, però so che quando abbiamo fatto il master non riuscivamo a proprio tirarlo fuori.
Vedi?
Un disastro.
Però non avevate il vortex.
No, sì, non avevamo il vostro, ma è stato un disastro.
Con l'acqua fisiologica pure,
Fisiologica,
vero?
fisiologica,
Non la
sì.
sterile.
No, fisiologica.
Okay. Quindi, as I said, now even with saline, there is no worries, no problem. So my injection point would be on my entry point of the cannula. In that way, scusami tesoro. Of course, I know my patient. She doesn't have any allergy to the anesthesia. I treated her many times. By the way, she's a lawyer. So I'm very careful with her. I can't do, she's beautiful, but at the same time clever. All my patients are like this. So, in a fan technique we will work. This is just my entry points. In the meantime, my vortex, can you also show, please, the vortex working on... È pulita, è pulita.
Vit, devi riprenderlo tu se vogliamo farlo vedere.
Ok, chiudila per favore. Buttare? No, è nuova, è buona. Quando sono chiusi da dietro vuol dire che sono nuovi. Lo vedi? Lo vedo, no? Ok, just 1 minute left. Ok. Yes, come. تعال تعال يا دكتور يا طبيب. Don't mix anything. I don't like to mix. Because what about if you have an inflammation? We don't know what is the cause. When I use polylactic acid especially, I don't like to mix it. You mix hyaluronic acid without problem. I know that there is a brand from a famous company which mix hyaluronic acid with polylactic. It's not my way to do things. I like to focus. Rather, I do for her polylactic acid. I wait 1 week, I do hyaluronic acid. Where is the problem? Why should I mix both of them? I can't do 2 injection point, more injection point, that I prefer to see which gave me the result, which product gave me the result, the hyaluronic acid or the polylactic acid. So I will work on fan technique. Com'è adesso? È più fluido, eh? È fantastico.
Comunque, se vuoi puoi prendere, cioè piuttosto che temperarla,
No, perché si è rotta. Okay, so in fan technique, of course, more line you will do and more you will have a better repartition of the product. On the body, it gives really amazing results. We will ask the patient to massage, even many times a day, to massage strongly the area. This is very important for the next 5 days. Ok? Capito? Bravissima. So, ma adesso è molto fluido, eh? So, no, exactly. Bravissimo. So what we did a first centrifugation, then we're gonna do the second centrifugation, just to be sure that you have the best mix. Because for the body, I need more volume, so I need to have a very good homogenization. 3 minutes each. So we still have 3 minutes. Yeah, I mean, the second time, you can do it even for less. Okay, but now you can see the difference. First, we couldn't even take the product. It was so strong. After the centrifugation, it's amazing, like it's very fluid. No worries. With the V10. So this is my way to do. I don't like to mix things. With VT, with V-body, yeah. Amino acids. But it's fragmented hyaluronic acid. He said it's fragmented. We have a fragmented hyaluronic acid. You said full hyaluronic acid, right? Hyaluronic acid, cross-linked hyaluronic acid. Your question. Your question is, you're asking non-cross-linking hyaluronic acid, but ours, the fragmented one. That's okay. You can, yeah, that's okay. But don't mix it with some other hyaluronic acid, non-cross. Yeah, this is a fragmented. We have a fragmented hyaluronic acid. It's different from the other skin boosters containing hyaluronic acid. In that way, yeah. So you would not. Oh, sorry, I was confused. I was thinking like you want to mix with any other skin booster, like the company. I know of Allergan or something like this. But usually, I don't mix. It's in the protocol. I mix only with the V-body when I work on the body. On the face, I don't mix usually. Okay, on the body you can, because you have also amino acids and so on. Body works differently than the face. But usually my procedure is I like to use one product at a time. Ok? Quando è pronto, io ti lo do dentro queste qua. Ok. Yes. We will then use 205 syringes for injection. Remember that more the syringe is big, smaller is the needle or the cannula, more force of extrusion you need to inject the product. So I advise you to have small syringes with small cannula. I mean 22G, maximum 205 ml of syringes. And lower lock better. I don't have it lower lock, especially with polylactic acid, you need the lower lock because sometimes the force of extrusion is not easy. So in total, we will have 16 ml of product that we can use for the body. Ok, la cannula, sì, per favore. The cannula for the body is better. I will show you, ti faccio vedere una cosa. Sempre fallo da qua, perché può entrare dentro qualcosa quando lo apri. Sì? Ok. Quando è pronto, me lo metti dentro. questo lo devi ancora
Questo qua è
mixare?
l'altra metà.
L'altro da
sì,
mixare
esatto. Abbiamo
ancora.
14 ml. Non
Ok,
16.
quindi inizia a darmi
12 più
questo
2.
da iniettare.
Sì. Allora, andiamo qua.
Certo, butta via tutto quello del paziente precedente, per favore, non vogliamo fare casini. Questo ago di chi era?
No, questo qua è un ago per prelevare.
Buttalo,
Questo qua per prelevare
buttalo,
tutto
buttalo.
via. Ok.
E dov'è quello della canula per entrare?
Prelevare. Io ho dato questi qua da 23G. si possono
No, per
usare.
entrare poi. Qual è per
Questo è
entrare?
quello per entrare.
Perfetto, non
Sì,
mischiarli, per favore. Ok, ready? Prelevami questo con il 18. Veloce. 18. The patient is very relaxed. I would like to be in your place, to relax a little bit on the bed. Yeah, only the polylactic acid you need a little bit of preparation. Little bit. It's a little bit longer. All the rest is ready. You need just to inject and that's it. Pronto? Fantastico.
Voilà.
Fantastico. Ok.
Disinfettante.
Sì, per favore. Ok, so now we will inject. Tienimi questo. No,
Questo.
per favore, questo e questo. Hai sentito qualcosa? No? Fantastico. Ok, dammi la canula per favore. Okay, see now how the product is perfect. Doesn't have any granuloma inside. It's like after mixing, after the vortex, it's amazing. It's absolutely fluid. Vuoi tenere questa? Così non la perdiamo. Here I am. Okay, so the subdermal layer. This is the subdermal layer. It's fine for you? You agree? In the subdermal layer, you can also move in that way and easily. It means that you are on the right level, okay? Okay, so stretch the skin and inject. Stretch the skin and inject on any line. And you need to massage while you're treating the patient. Then change line, stretch the skin. They're not seeing anything. You need to tell me, huh? Maybe with the other hand. And remember, longer cannula will be better. This one is 5 centimeters. Have, please, the 7 centimeters. Change layer, change line, and go. Remember to stretch the skin. We are on the right level because you can see the cannula moving. Change again. Dobbiamo fare la foto, ricordami, eh? You are on the right level. You're not too much superficial, you're perfect. And then inject. But after the centrifugation, it's really very fluid. I don't have any force of extrusion. I'm not using, it goes very smoothly. Scusami, caro. Okay, this is the right level. Perfect. Dammi per il resto, per favore, ancora. Riempi. Tu mi puoi preparare altre siringhe se vuoi,
Ok, infatti
Certo.
pensavo di fare una e una.
Sì. Ok. This is done already. So then, after the treatment, we will do a very strong massage. Di più così togli l'aria. Ok. Di più. Hai sentito male? So the patient didn't feel anything, any pain. Usually it's extremely painful. Because of the preparation, dammi l'ago. Un altro disinfettante.
Disinfettante.
Grazie mille. Ok, fantastico.
Siringa la prendo io.
Ok. Scusami tesoro, perché forse sono andata oltre. Ok.
Ok.
Lo togli tu?
Tolgo questo. 1, 2, 3.
Yes. Ok, dammelo ancora. Dammelo ancora Lago. Grazie. Non mai fare così.
Ok.
Pericoloso. Meglio, questo non l'hai sentito, vero? Ok, so to open better.
Prima no, meglio, sì, meglio.
Ok, perché non sono entrata prima. Non fare mai questo, è pericoloso. Potrebbe entrare dentro. Infatti. Ok, so, sorry, sweetie. Okay, so I'm too superficial. I will go a little bit deeper. Come mai? Okay, so this is the right level. Stretch the skin, inject, stretch the skin, inject. And remember to ask the patient that the results she begin to see after 1 month, 1 month and a half, but you need to do some retouch after 1 month already. Come va? Ok. Sì, eh? We are all sensitive from one part. Qualche parte siamo sensitivi un po'. So it's like you're injecting some fluid product. It's really very easy. The same technique of injection. That doesn't change. Nothing about the skin boosters and so on. Dimmi quando non stanno vedendo, quando nascondo. Ok? Già pronta?
Sì, sono i
Ok.
2 perché sono 7, quindi 2,5, 5 più 2, 7.
E il resto
le altre
possiamo ancora?
14, adesso li mischio.
Ok. Adesso cosa mi hai dato?
2, perché sono 14, quindi 7, 7, 2,5, 2,5.
No, adesso mi prepari altro?
Sì, adesso ti preparo l'altro.
Ok. Devi farlo centrifugare? Ok. Qua hai sentito qualcosa?
Leggermente. Va bene, è un po'.
Tieni Eugenio, per favore. Okay, so this is the right level to inject. Sorry, it's a little bit boring for you. Is it boring? You're sure? Because I have too many entry points. Someone want to inject? Posso fare iniettare qualcuno? Posso fare iniettare qualcuno? Someone want to inject? Come. My patient is agreed to be injected only by a beautiful doctor. Ho detto alla mia paziente, d'accordo, vieni. Così you show also your expertise with me. Help me a little bit. You still have 1 ml to inject in this area and this area.
How much?
1.5. I inject the middle, inject here and here. Okay? He's the trainer of Libya, Infini trainer of Libya, right? But he can't talk when he injects, see? He's not. Don't touch the cannula. Pinch the skin. No, pinch the skin, yes. Pinch the skin always. Aspetta. Wait. Still la cannula, don't touch the cannula, please. Because it's not sterile gloves. No, wait, 1 second. 1 second. Can you give me, please? So, to have the... No, wait. Just pinch the skin. I will show you. You don't need the guide. Look. Just when you pinch the skin... It's already closed. You took the right one? Dammi un disinfettante, per favore. Okay. Because you went outside. Don't go outside. Stay inside. Yeah. And please, when you don't have sterile gloves, try never touch the cannula, okay? Show me, stretch the skin. Don't go outside with the... Yeah, stay inside, exactly, that you will not lose. Tutto okay, cara? You're a little bit superficial, be a little bit deeper, okay? Qua. Okay. Perfect. Fantastic. See, it's very fluid. After the vortex, it's amazing. Ok. Dammi un po' di crema antibiotica già. Grazie. Thank you. Yeah, so if you want to be more comfortable in your practice, wear sterile gloves, have sterile stuff, and you can even touch the cannula. Whenever, if you are very accurate, you're sure that you will not touch the cannula, poi me la prepari qua. Perfetto. Then we will do strong massage of the area to make a better compartment, better homogenization of the product. But really, this... Sì, perché abbiamo finito, manca solo questo. Because this vortex is amazing. It prepares you the product immediately. And as our colleague, what's your name? عاطف شرفيني عاطف مرحبا بك في ميلانو مرحبا. So as Atif, he could feel it's very smooth and it's not lower lug syringe. Usually with other polylactic acid, you try to inject, the syringe explodes, everything goes everywhere. So that's the way of the vortex. It works. Huh? Yeah, see? It's absolutely very smooth to inject. It's fluid, almost. Okay, so the rest of our product is getting ready to do the last injection. I know that less... Questo è un po' più meno omogeneo?
No.
Sì?
Sì,
Ok,
sì.
perfetto. Ok. Sì. Sì, dammi tesoro la needle. L'ago d'ingresso. Grazie mille.
È già sbloccato,
Fantastico. Tieni così. Ok, so. Sembra che l'anestesia l'ho messa qua. Non hai sentito niente, vero? Niente. Perfetto. Ok, so that's why the adrenaline is very interesting because at least you see where you injected. Sono già stanca. Stanca morta. Mamma mia, 2 ore in traffico in macchina. Più mi sono svegliata alle 5. Ah sì? Poverino. Okay, this is the right level of the cannula, okay? Subdermal level. You can move. You're not on the dermis. You're not too much superficial. We'll begin to inject. Fan technique, retrograde. Stretch the skin to be sure that we will have the right depth of the cannula, that will not change depth. When you stretch the skin, you're sure the cannula stay on the same layer. Come va tesoro? Tutto ok? Fantastico. Dobbiamo fare le foto, ricordami. Del primo. Ok, fantastic. Ancora?
Sì, ne abbiamo.
Allora faccio qua.
E poi ne ho altri 2 ml.
No, basta. We'll put a little bit more here. Sono andati via?
È molto meglio, mi sembra.
Sì. Poi c'è l'iperosmolarità. Okay, next patient. I'm sure you will not be annoyed. Because it's a long job what I'm doing. Okay, sorry. Ti faccio male, tesoro? Okay.
Benissimo, perfetto.
Okay, she's very comfortable, the patient. She didn't feel anything. The wrinkles are already gone. Allora, dammi adesso l'antibiotico e poi la crema per fare un forte massaggio. Ok? Sì. Guarda, we already see, yeah, right? Dammi di più. This is fusidic acid. Okay, on the entry point. Then the cream to massage all the area. You know, dammi di più. Che tirchio che sei, eh?
Sei schiacciata a te.
Okay, so strong massage with the fingers. The only thing that you need to be careful, if you use it for the neck, don't massage too much the neck, the patient will lose consciousness because of vagal nerve, and it already happens to my colleague. My colleague did an anesthesia with adrenaline and lidocaine, and he was keeping massaging the patient. He lost her. He lost her. He lost her. I said, what did you do to the patient? Nothing. I just massaged strongly here on the carotides. That's it. So on the neck, be careful of strong massage, please. Huh?
È quasi un'ora al giorno che bisogna massaggiare, quindi non è poco.
Important, the massage. Ask the patient to massage. And I already can see the distension. Of course, because we have, the water attraction and so on, because of the hyperosmolarity of hydration. And
Giù a mo'.
sì. Tutto ok, cara? And when you use adrenaline with lidocaine on the entry point, you don't have any bruising, you don't absolutely have almost anything. Vedi meglio, vero? Ti vedi meglio? Fantastico. Scusa tesoro che ho 2 altri pazienti, non posso farti troppe cose anche sul viso, ma ti promesso vieni in studio e ti facciamo un bel trattamento.
Quindi io finisco adesso.
Oh, sì. Ti va? O vuoi fare il collo un po'? Collo?
No, però
Cosa vuoi fare?
non va bene anche.
Cosa vuoi fare?
Una cosa l'avrei fatta sul viso e sul collo, però vedi
Dimmi tu,
che difficoltà.
cosa preferisci?
Perché è veloce.
V5?
Che è veloce, facciamo.
Ok,
Secondo.
dai.
Tipo prof.
Dai, dammi il V5. Ok, so for this beautiful patient, dammi ancora un po' di crema antibiotica. Antibiotica, per favore. I hope that you can see everything. I'm not hiding with my hair or anything. The last time I will put on the entry point some antibiotic cream. Ok.
Vuoi ancora un po' o sono a posto? Così ti apro la fiala.
Ok, perfetto. You can close your. She want to be? Ok, posso fare venire una dottoressa per favore? Tu vieni a casa, ti faccio tutto. Ma tanto vieni in studio poi, che ti faccio con calma, va bene? Eh? No, fa niente, apri per l'altra.
Ah, ok.
Ok? Ok. Ok. Hai capito?
Sì, però sono giornata di lavoro, comunque andiamo.
Ah sì? Allora aspetta. It's gonna be Anna. 1 second. Give me the V5. Ok, so I will do the 5-point. Siediti un po' meglio. Sì, per favore. The 5-point on the face to lift the face. She's beautiful. That because we did some energy-based device, we did some skin booster. Anche loro mi dicono di portare i pazienti e poi vogliono trattare i medici, capito? Dall'inizio potevano dirmi di non portare tanti pazienti, capito?
No, però se ti metti
Modelle. Ci metto un secondo. Other disinfection. So, avevi fondotinta, vero tesoro?
sì, un po'.
Ok. Ok, so, the 5 points. Chiudi gli occhi, non ti entra niente dentro. The disinfection is primordial. It's very important. Disinfezione. Questo è un biostimolante fortissimo, ok? Tipo il profile. No, io lo faccio sempre Infini o Ok.
Dammi il cicino che
No, me lo tengo. Okay, so V5, sorry, I didn't tell you. V5, the V5, because V5 point lifting technique. So we will do, sorry dear, very slow injection. Come va tesoro? Tutto ok? Fantastico. Dammi una garza. Come va? I'm on the dermis level. Scusami tesoro. Perdonami. Tutto ok? Vale? Con disinfettante, per favore. And you massage your injection. I will do a little bit more in the zygomatic area and a little bit deeper. In sandwich technique, donc a little bit on subdermal layer. Ok, caro. Tieni questo.
sì, questo ve la porto via.
Ok. Tutto ok, cara? Mi dici, se ti do fastidio, tesoro. Tanto male? Ok. Massaging the area is very important. So you need to understand. We have 2 ml in total, right? And we don't want to inject big bolus. I don't like big bolus because big bolus can give complication. Small one cannot give complication. Okay? So I like to inject small bolus, and rather I use the rest on the neck. Following the venous lines. Is it painful? Ti fa male, cara? Okay. Honestly, I don't like to use big boluses as they do in other companies, other products. So I will just compare all the product on the whole face. Figurati, cara. Non capisco comunque. Mi dispiace. Non l'ho mandata col paese. No, nel senso l'ho detto, l'ho fatto lo stesso. Ok. So be superficial. So the neck is very thin, so probably you can see the papilla. Can you see? Yeah? Tell me please if I'm hiding you, anything. Be superficial to avoid the veins and follow. You need really to see your needles. The venous lines, I'm sorry. So don't worry if you use feed spapula, you just need to massage, but not too strongly on the neck, as I told you, because of the vagus nerve. And you can also treat, dammi un'altra garza, disinfettami il décolleté. All the rest of the product on all the face, because it's very powerful. You don't need to use a huge quantity of product, and you're gonna have a very nice result. Tienimi questo. Disinfettami anche il décolleté. Fantastic. Okay, I usually also inject the décolleté area. Dimmi? Dimmelo, perché sennò se non vedono niente. Schiaccia questo. Ho fatto un lividino, cara, scusa, no? And remember also to change the needle. It's gonna be less painful for the patient. Sorry, tesoro. See, my inclination of the needle is almost 10 degrees. So I'm superficial because I want to inject on the dermis. I don't need to inject in the subdermal layer. Tieni questo.
Non chiudo perché è praticamente finito.
Dammi un po' di disinfettante, l'acqua ossigenata. Tutto ok, tesoro? Oh, che fantastico. Ok, dammi la crema antibiotica. Mettiamo dappertutto. Ok, done. The papilla, well, around few hours. That's it, not too much. No, it's not cross-link. It's V5. V5 with 3 LS. Ti fa male qua, tesoro?
Abbastanza.
Li vedo qua. Dammi un po' di acqua ossigenata.
C'è una carta di Queste qua sono un po' più pienotte.
Sì, sono un po' più.
No, parlo con lei, sono un po' più pienotte, belle piene di acqua ossigenata queste. Sono quelle sotto di prima.
Ok.
Va bene.
Bene, avrei un livido qua e basta. Va bene,
Sì,
tesoro.
dai, grazie
Perfetto.
mille. Ciao,
Ok.
dottoressa, grazie, dottore.
Figurati, caro.
Ciao, a posto.
Fammi vedere. C'è un livido qua.
Vabbè, pazienza.
Grazie mille. Thank you for the patient. I will do for her the 2 lifting point with the filler on the periost, deep injection of around 0.1, 0.15. And then on the top, I will inject the V5 with the cannula in 5 points with 1 entry point of the cannula. 1, 2, 3, 4. Ok. Sì, questo è filler proprio. Ok, so I always have my finger, sorry dear. I touch the bone, even if I'm on the bone, I will aspire. For 10 seconds, and we'll inject very slowly. Very slowly. Come va? كيف حالك؟ كويسة؟ الحمد لله. .2. Dammi un po' di disinfettante. Okay, so they're the lifting point and the light, where the light will come as soon as you see the patient. And the wow effect is when you inject deeply. This I can inject deeply. It will last, and it will give me the results I want. I will inject my second point. You don't have any allergy? ما بتاخدي drugs? Okay, medicine or so on for the heart or anything? Okay, bismillah. Okay, my second point on the bone. I aspire always for 10 seconds. Remember that. 10 seconds. So what is the difference with the Arabic skin? The Arabic skin is very thick. Thick. Inject very slowly. Come va? Tutto. All okay? حلوة? Okay. Other 0.2. I'm using the L plus. Okay? Can you sit? Can you sit, please? And look at her. Wow. Very nice. Non bagnarli troppo. Okay, she already had some filler. If you take some patient virgin what never had any filler, as soon as you inject these 2 points, you see the lifting. That's amazing. This is the 2 point, the lifting point I usually have. Okay, then I will do the other side. And then we'll inject with cannula. I mean, she's not the ideal patient for that, but these 2 lifting points are just amazing. Non bagnata, asciutta. E dentro la cannula mi prepari il V5 e un po' d'anestetico anche per il punto di ingresso. Ok, bismillah.
Preparo il V5 e lago per il punto di ingresso.
Esatto. Sorry. Even if I'm on the periosteal area, I aspire for 10 seconds at least until I see no blood, and I will inject very softly, very smoothly. Ça va؟ حلوة؟ تجنن؟ شكرا حبيبتي. Okay. Bismillah. Questa è bagnata o asciutta? Dammi una bagnata gentilmente. Poco, non bagnarmela tanto.
Perché di quelle grandi siamo molto molto a corto.
Ah, sì? Okay. I have always my finger. Sorry, dear. سامحيني. Okay. Perfect. So these are the lifting point, and let's do the V5.
Questa la prendo io. È già
Sì.
caricata, non c'è bisogno che togli la.
Devo mettere l'anestetico prima.
Ah, ok.
Okay, so my entry point. Un po' d'antisettico, per favore. But already, sit, please. La bagni troppo. Non bagnarla troppo, per favore. Nice. Can you see the lifting effect? And it wasn't easy on her because she has a very thick skin and her skin is full. So, I mean, I needed a lot of product and I injected deeply. But you can see the lifting effect, the projection effect with only 2 points. If you inject in that, exactly in this area, we have the retaining ligament, you're going to have this effect, but with cross-linked filler. Then, let's see the V5. We will do it with the cannula. In that way, I will show you. Go ahead, bismillah. You don't have any heart problem, Usama? Fix, سهد. You're swelling here. Yes. Yeah, you're sweating. Normal? Right. Okay, bismillah. Give me, dammi una garza asciutta, per favore. Ok. Tu domani lavori? Vuoi venire da me in studio a darmi una mano?
Oh, sì, va bene.
Dai.
Non so esattamente cosa faccio, devo controllare sulla agenda. Ma magari adesso
Fammi
arriverò.
sapere, domani tutto il giorno sono in studio, ti pago ovviamente.
Sì, no, ma dove essere?
Noi ci mettiamo- no, è che mi fai da assistente
Sì,
perché
sì,
non ho
sì.
l'infermiera. Ok, so entry point with which I can work with the cannula. Sorry. Ok, lidocaine und adrenaline. Do you have some pain somewhere? You're fine? فيك حريق ولا شي حاجة؟ هنا؟ كويسة؟ الحمد لله. Okay, we will wait few seconds and we will introduce the cannula. I'm sure that all the distributors, they run away. We have only doctors here, right? Someone want to inject? Ah, no. I don't think that she want to be injected by someone else. I'm sorry. Sorry. My patients are okay, but you are doctors, so no. Okay, wait few seconds. You remember when you use the adrenaline, wait few seconds before injecting. Grazie. Sono informissima, guarda. Ah sì? Vai.
No, ma
È sotto.
quando cambiamo paziente, già,
Ok.
allora, l'ago già staccato.
Ok, fantastico. Ok, would you just the entry point, okay? Bismillah. Did you feel something? No, fantastic. Toglilo e dammi la cannula. Remember to remove the air from the cannula, please. Fantastic.
1, 2, 3.
Yes,
via.
go. Bismillah. So, if you can see, she has acne and she has Arabic skin, so very thin. I can feel with the cannula. So you can do the subcision with the cannula, which is not a bad thing. Okay. My first point will be here. I'm the subdermal. Superficial, subdermal. Then my second point will be on the zygomatic area. Can you see? Dimmi se mi devo spostare le mani perché io non vedo la telecamera. I can feel the fibrosis, I can feel the scars, and I will do some subcision with the cannula. See here, I'm superficial. .2, even here. Then it's really different when you have a acneic skin. Okay, I will need the needle again because I changed direction. Exactly. Sorry for that, dear. Toglilo.
Sì. 1, 2, 3.
Sì? No, è pieno di sangue qua. Aspetta, dammi la garza. Veloce, dammi la garza. Okay, we were on the vessel, so it's good. I didn't inject here. So when I introduce my needle, you could see the blood coming out of the needle. So in that way, we are on a vessel. Dammi un'altra.
Asciutta. Se vuoi dammi la...
Butta questo sangue. You're okay, my dear? Yes. Fantastic. Penso che qua ci abbiamo un po' di livido, pure. Ok, quindi faremo un altro punto di ingresso. E cambio i guanti. Tu fai l'emostasi così, per favore? Vado a cambiare i guanti. So actually, Eugenio, he's my student in the University of Genova. So I met him during the master, and he's here for helping me. Thank you, Eugenio. He's a future aesthetic doctor. فيك وجه حبيبتي؟ Ok, fantastic. Abbiamo ancora un po' d'anestetico?
Tipo un cicino, 0,1 tacchetta, tipo c'è dentro.
Ok. We'll do another entry point. Hai fatto l'emostasi? Fatto?
Tolgo?
Ok. Penso che qua ci abbiamo un livido pure, Vero, Ok, so I will change my entry point, disinfettante.
Queste qua rimangono bagnate. Perché sono le uniche che abbiamo.
Sorry, dear.
Cioè si deve accontentare. Devo preparatene ancora un po'.
No, basta. No. Però è un semplice livido.
Io lo so.
Ah, pensavo. Ok. Ok, dammi la lago prima.
È già staccato, quindi non lo faccio.
See, if you can see the blood here. This was a vessel, so sometimes when you introduce, dammi un altro, fa niente. When you introduce the needle, toglilo via. When you introduce the needle, you can see something, sometimes even before introducing the cannula, the blood coming from the needle. Please, don't inject. Remove and change entry point. As in that case, you can see the blood was coming out from the needle. So I immediately saw that I was inside a vessel. I immediately even didn't inject. I will change entry point. So this is the small things can happen. So be careful of that. Not because you have the cannula, you're absolutely safe. Okay, let's do the entry point from here. No.
No, questo è giusto che la carta, perché le dobbiamo proprio per
Sicuro?
Sì.
È un 21 questo, deve essere un 20. No, deve essere un 20. Perché la cannula è un 22. Apri un altro ago verde pure.
Non credo.
Ok, dammi quello verde. Ok, dammi la cannula. Così we will do the last point. Questo è stato il workshop. So if you want to enlarge into whole, just do this movement. Not like this or this. I don't know. Dammi una garza, veloce. Non guardarmi. Ok. Tell me. This patient, she's beautiful. She's bleeding a lot, but she's beautiful. Cosa ha detto?
Che abbiamo 40 minuti che ci rimangono.
Ok. Ok, so. بتاخدي اسبرين؟ فيك ما خديتي؟ خديتي الأسبرين. See? So the patient has taken some anti-inflammatory. Okay, one. Some aspirin, right? That's why you're bleeding more. My God, you're bleeding a lot. You bleed a lot? Okay, and the last point will be okay. Perfect. You know the idle. Asciugala bene, fai la compressione, è quello che devi fare, devi pensare. Ok, facciamo l'altro lato. We will do the other side. Dove l'ago? Per entrare? وسخت لك I'm sorry for that. You're a bleeding patient. So usually I will already do all my oh my God, she's bleeding a lot. Una garza. Guarda. You're not the idle patient, my dear. Did you take aspirin? What did you take today? What? Panadol. Yeah. Okay, 0.2 here. Sto coprendo. Okay. The second point will be on the zygomatic area. I'm on the subdermis, superficial subdermis. Sorry. وجعتك حبيبتي؟ Okay. Prepara una garza sempre con la tua. Fantastico.
Aiuta.
You see? Sorry حبيبتي. You still say that the ايدي خفيفة ولا did you change mind? I told her you're still saying that my hands are nice or you changed mind. I think she changed mind. So with one entry point, especially if you have 7 centimeters cannula, you can do your 0 point, 2 point, your 5 point with only one entry point. وجعتك حبيبتي؟
شوي إحساس.
Yeah? Okay. Okay. It's not my fault. She's bleeding too much. She had some anti-inflammatory, non-steroidal anti-inflammatory. Okay, that's fine for her for today. Give me some antibiotic cream. Anna? So, what you feel like to see now? Which treatment you feel like to see? Let's see the V2 on the neck.
V2.
What do you think I should use now? Yeah, okay.
C'è una che vuole... scusa.
Give me more, give me more.
V2 on her neck.
Okay. Perfect. Yes, okay. So, Leina? Okay, my dear. Sorry for the bruising, but it's next time don't take any anti-inflammatory. Sorry, I waited there. Okay, that's fine. Look, can we see her before? So, two technique, needle plus cannula, V5 plus L plus. Filler L plus, deep injection on the periost. And she looked really very nice. Do you have a mirror that she can see herself? Concentrati, vieni Leina. Like, look at yourself, sorry, look better. See, we did so the projection with the L plus deeply on the periost. Then with the cannula, I inject you the 5 point with the V5. In that way, I will have the support with the filler, which is injected deeply, and the skin revitalization of the skin, giving more lifting effect. Okay, so I will show you, I will treat her with V2, especially her neck, and also on the face, I will use the V2. So the only problem, if you want to treat the face, that you can't leave many papilla on the face. Like she will like look not very nice after. So I will try not to have many points of injection. On the neck, it's fine. She can cover it with some scarf or anything. This is no problem. So let's see. Hai qualche allergia qua? Yes, vero? No. Aspetta, ti faccio vedere. Ho l'antisettico che te l'ha fatto. Ce l'avevi? Un pochino di puntini rossi. Normale? Okay. So for this patient, maybe have a photo of her. I want to project you also the Nefertiti lift injection, what you asked me. And I have a photo of her, so I did for her. Where I have this photo I want to show you, but then we need to project. So I did for her the zygomatic area and the chin. She absolutely, she looks a V. Before she was like invert triangle. Remember the photo I sent you? Okay, so how we treat the marionette lines with fillers. She's not the ideal because I already did for her the treatment 6 months ago, right? So I will do my entry point exactly on the attachment of the DAO. Then I will work on fan technique. 1, 2. I will sustain the angle of the oral angle. Then the same thing I will do here. We'll do 1, 2, 3. My entry point will be exactly here. Okay, dammi disinfettante, un po', little bit of anesthesia on the entry point, especially with adrenaline because this area bleeds a lot. And never feel too much this area because it's a mimic area. It doesn't seem so natural. As per the nasolabial, as doctor, he left. I don't remember. He's from Libya. Amir, yeah, you're here, Amir? Yes. So you asked me about the nasolabial folds. The nasolabial fold, my entry point is here with the cannula. Okay, and I feel it superficially, but always cannula 22G. Okay, small entry point here. Anesthesia with adrenaline. I'm not hiding, right? You really need to see the papilla when you inject. Okay. Then prepare me the V2, please. Yeah. I will inject it on the neck. Because because I think she has a beautiful skin quality. Okay, I have treated her with HIFU, with high intensity ultrasound already. I did some filler, I did some skin booster. So she doesn't need that big amount of like that strong bio-revitalizer. I will inject all the neck and face with V2, it's gonna be fine. And she never had any amino acids, like combination with hyaluronic acid and amino acids, so I want to try on her to see how it works. I see the skin aging is not so, right? She's good because she does treatment often. Look at the quality of the skin. But if I show you her photos like 5 years ago, she looks another person. Hi, Leina. No, she was beautiful, but she looks much better now. Ok. Da uno meglio. Sorry, I can't hear you. Absolutely. Yes? Yes, absolutely. So the thing that the V5, it's stronger. It has more hyaluronic acid. The concentration is higher, so you're gonna leave some signs. I mean, some papilla. You're gonna see the papilla. No, it's gonna last 24 hours maximum, not more. Instead of the V2, it's very liquid. You can really inject it everywhere with a lot of point injection, and it's easy to use. The V5, when you want like this once a month, you do the V5, it's nice. V2, you can do it after 2 weeks, you can repeat it. This is very liquid, you're gonna see, and that's not effective, but it has less endpoint, and less post-operating, like post-act. Yeah, it's only hyaluronic acid. It's just a bit stronger. I want to inject all her neck, and she has some event, so I want to try the V2 on her. That's why I choose it. But of course, you can use the V5 also. She's 48 years, right? 50. Wow. Amazing. Yes. Yeah. We will begin with the V2. Lascia il tempo che faccia la canula suo tempo. So the V2, if a patient comes very often to you, she wants to do it like every 2 weeks, no worries. We want to combine with some energy-based device, you can use it. The V5, it's a real skin booster, which will last more. It's like once a month, it's fine. Not more. Mi stai dando la canula? Ok, il filler questo? Non ho bisogno di canula. No, col lago. Sì.
Cosa vuoi?
La canula uso col filler. Lago piccolino. Quello grigio, molto molto sottile. Hai cercato bene dentro il cosino mio? Sicuro? Ok, perfetto. Remove the air. Okay. You can do also the retrograde technique, In that way, you will not have, Scusami tesoro. Is it painful? Aleina? Hai disinfettato tutto il collo, vero?
Sì.
Ok. Preparami un altro siringa piena, sì. Così cambio solo l'ago. So I'm using the V2. See, it's very soft, very smooth. You can inject it, and the patient will not have any bubbles. That's why because she had some event, right? You don't want me to... Prepara quel lago, così almeno già pronta. Perfetto. And I'm using a small syringe. In that way, it's more smooth va benissimo. It's more smooth to inject. Remember, small needle, small syringe, nada con garza con disinfettante. Retrograde technique. Tutto bene, tesoro? The quality of the needle is important also. So this patient, she's not bleeding a lot, huh? Scusami tesoro. You can use these bubbles, otherwise, the papilla technique, otherwise the retrograde technique is very fine. You do some type of subcision also. They can't see. Girati tesoro un po'. Scusami tesoro mio, ok. So she feels only the needle, she's not feeling the product. Hai preparato un'altra siringa? Sì. Fantastico, dammela. Ok. Cambia l'ago, ce l'hai un altro ago? Appena sei pronto cambio l'ago. Show me. Also, don't forget also. Scusami tesoro mio, molto fastidioso. Eh? Scusami tesoro mio. 10 degree of inclination of the needle, because you need to be, when you work, when you do the retrograde technique, you need to be very superficial and be careful, that you not go deeper, because we don't need to go deeper. Respira. Let me do your décolleté also. So I'm doing the retrograde technique, but I'm very superficial. You see the inclination, it's 10 degrees of the needle, not more. Abbiamo finito le 5 ml, vero? And you have 5 ml, so you can do neck, décolleté, and also the face. Now I don't want to do her face, I don't want her to feel like with all papilla around. That's fine, basta. Ok, dammi il filler. Sì, sì. So I will use M plus. Dammi la crema antibiotica. Scusami tesoro mio, ti ho fatto un lividino, eh? Mi perdoni? Tutto. Mettili tu la crema antibiotica. Metto io, ok. Prepara il filler.
Ha dentro la vita 27, Cosa vuoi con la canula?
No, con canula. Scusami, qua ti ho fatto un bel livido. Eh?
Lascia l'ago da 27.
No, dentro la canula. Ti ho sporcato la camicia. Aprila. Ti ho detto di venire nuda. Apri, sbottola che te l'ho sporcata, mi dispiace. Ok, so let's do the marionette lines.
Già staccato.
Poi cambio i guanti che mi stanno scivolando, sì. Hai sentito qualcosa? Tesoro? Ok, so you're here. You're going to inject small quantity, fan technique. Tutto ok, tesoro? And you will do some support of the angle of the lips. And the most important that with the same entry point, scusami tesoro, ti faccio male? Ti ho fatto male? Ok. With the same entry point, you can also feel the chin and Labiomental area. Ok, l'altra parte. The massage is very important also. No, dammi la crema antibiotica per massaggiare. Ok. Come va tesoro? Fantastico. Ok, dammi l'ago. Tieni questo che cambio i guanti, che scivola cosa. Questo è stato più lungo in assoluto per me. Un workshop in assoluto. È troppo, come Genova.
5 minuti.
Sì. Vai, vai.
No, ma adesso finiamo
Disinfettante? C'ha disinfettante? Fantastico.
anche qua c'è qualcosa.
Eccomi tesoro. Hai sentito qualcosa qua? Niente? Ok, dammi il filler. Poverino, da un'ora che mi dici del pipì.
2, 3.
Ok, so you're gonna, sorry tesoro, scusami. Infant technique, retrograde injection, not bolus injection, you change. Sorry. Okay. So this is the way I do my marionette lines, always with the cannula. Sorry, scusami tesoro mio. Male? Tanto? Me lo dici, eh? Okay, and do the same way, of course, if you need to improve also the jawline, you can also inject this area. Okay, give me the antibiotic cream. And let me massage, we are done. Okay, so the patient, unfortunately, after the skin booster, the patient looks a little bit not nice immediately after. It's not like with fillers, when you use the cannula, she look amazing immediately after, and so on. Ok? Ti puoi sedere che ti vediamo un po' così. Okay, you can see the sustaining that we sustain the nasal, the angle, the oris angle, with only one entry point, and you don't see any sign in the outside. So you see that her lips are lifted, especially the angle.